Good morning and welcome, everyone. I'm calling the 430th Council meeting to order. A quick reminder, Council members, please have your video on during the meeting. We are live streaming this meeting through the RCDSO's YouTube channel so that members of the public, the profession, and other stakeholders can observe our proceedings today. Today in this virtual space, we wish to acknowledge the land on which our college sits. For thousands of years, it has been the traditional land of the Huron, Wyandot, the Seneca, and most recently the Mississaugas of the Credit River. But with many of us so far away from the RCDSO building, we invite you to reflect on the traditional lands in your area, which are home to many Indigenous people from across Turtle Island. We acknowledge and honor the ancestors on those traditional lands we are on today. We stand in solidarity to murdered and missing Indigenous women, girls, transgender, trans-identifying, and two-spirited people. Thank you. I'm now going to call on our Registrar, Dan Faulkner, who will do the council roll call. Dan?
Good morning and nice to see everyone. I'll start in alphabetical order as usual. Nalan Bhargava.
Present.
David Bishop.
Present.
Amelia Chan.
Present.
Ram Chopra.
Present.
Jamie Colliver.
Present.
Christina Cordero.
Present.
Peter Delane.
Present.
Nancy DeSanto.
Present.
Mark Eckler.
Present.
Lee Fisher.
Present.
Vivian Hu.
Present.
Richard Hunter.
Present.
Benjamin Lin.
Present.
David Mock.
Present.
Joseph Richards.
Present.
Harinder Sandhu has sent his regrets. Gildo Santos.
Present.
Brian Smith.
Present.
Osama Solomon.
Present.
Rod Stapleforth.
Present.
Mark Trudell.
Present.
Sandy Venditti.
Present.
Jack Wasserman.
Present.
Judy Walikovich.
Present.
And Cam Whitmer.
Present.
Thank you very much, everyone.
Thank you, Dan. I'm now going to turn it over to Dr. Sandy Venditti to provide the president's remarks. Sandy.
Thank you, Hanno, and good morning, everyone. So before we begin, I'd like to take a moment just to acknowledge the ongoing crisis in Ukraine. It's devastating to see that the war continues and the impact it's having on so many people. My thoughts are with all those who are affected and for those council members and staff who have family and friends in the Ukraine or Russia. It's a challenging time and you have our support. Turning to matters closer to home, it's a very busy time at the college. Dan will provide some highlights in his report, but I'll comment on a few items that stand out for me. Following February's special council meeting, the executive finalized a submission to the Ministry of Health. And I thank you again for the good discussion and input at that meeting. Your feedback was incorporated into the final draft, and I think we put forward a very strong submission. Our work and discussions on governance and other reforms is far from over. In our submission, we've offered to provide any additional assistance to the ministry as it considers the submissions of other health regulatory colleges. In terms of next steps, we're expecting the ministry to develop further proposals or even draft legislation. And we'll have an opportunity to provide input into this next phase as well. And this item will continue to be a focus here at the college over the next coming months. Engagement with both the profession and the public was emphasized at the special council meeting. And it also lines up with our strategic plan. So we'll work on enhancing engagement regardless of where the government lands in terms of governance reforms. And as for our own work on governance, I'm excited to be bringing back to Council our work around Council evaluation and performance. We've been well supported by Sandy Varakia from Satori Consulting, and I want to thank all members of Council for your engagement and participation in this issue. I've certainly found the evaluations to be a very insightful exercise. Today, we're going to have a chance to hear your feedback about the process and what you've learned. And as always, please feel free to speak freely and openly. It's important to hear all your perspectives. And before I turn things back over to Hanno, I want to recognize two very talented individuals who are set to retire from the RCDSO at the end of March. Kevin Marsh, Director of Communications, and Michael Gardner, Director, Quality. They have both made a significant contribution to the college during their tenure with us, and I know I echo all staff when I say they leave very big shoes to fill. So Kevin and Mike, on behalf of Council, thank you so much for all that you've done to support us over the years and for your contributions to the RCDSO's successes. We'll miss you both, and we wish you the very best of luck in your retirement. And finally, there are countless hours of preparation required before, during, and after a council meeting to ensure that it runs smoothly. It's a big production with many moving parts. And I would like to acknowledge the hard work put in by Dan and his team. In particular, Andrea Foti, Angie Sherbin, Kathleen Schiegel, Angelo Avesias, Sophia Rizzo, Lara Thacker, Caitlin Regina, Vatsal Soni, Aldwin Armstrong, Altaf Hatia. Oftentimes we forget that all of us have a life outside the college. In spite of whatever challenges the team may be facing, the quality of work always remains top-notch. So on behalf of Council, please know that we greatly appreciate every staff member for everything that you do each and every day. And to my fellow Council members, thank you for your time, your commitment, and dedication to always act in the public's interest. Please continue to voice your opinions as diversity of thought leads to better decision-making. And with that, let's have a great meeting. Hanno, back to you.
Thank you, Sandy. Before I ask members of Council to declare any conflict of interest, I would like to remind you that conflicts are important to declare because of our public interest mandate and as a standard reflected in the Ministry of Health College Performance Measurement Framework. Do any members of Council have a conflict of interest for any of the topics discussed today? And I'm just going to scan my pages. I am seeing no indication that that is the case. Thank you very much. And we will move on to the next item, which is the consent agenda. And a reminder to Council that we're continuing to use the consent agenda as a time-saving mechanism. We've grouped multiple items that are for Council's information, and Council will be asked to approve them in one motion. Council, you can, of course, ask any questions of clarification about an item on the consent agenda, but if you wish to have a more fulsome conversation about an item, we will take it out of the consent agenda and address it later on in the meeting. As always, I'm asking you to please use a very high threshold when asking to remove an item from the consent agenda. This is really just so that we can manage our time effectively and make sure that we're reserving time for robust discussion on our decision items. The materials for the consent agenda are found in your meeting package, starting on page 4 and continuing on to page 162. There were also 2 documents that were sent out as a late package last week, a financial update and a letter from the Ontario Fairness Commissioner. Dan will be speaking to the Fairness Commissioner letter later in the agenda. With respect to the minutes, we've asked Council earlier this week to please send any typos or minor errors you've noted in the minutes to Angie in advance of this meeting. Nothing was received from you. Does anyone on Council have a clarification question on an item in the consent agenda? And you can either put up your hand through the reaction button at the bottom or through chat. I see that, okay. And what I am going to ask you right now, I see Peter and Jack physically raising their hand, which is fine, but I'm working through multiple screens. So I will ask if you can to either indicate through chat or at the very bottom, the toolbar at the bottom that says reaction. If you click on that, you can do the raise hand. But I'm going to turn to you, Peter, first, and then to Jack. So Peter, please unmute and ask your question.
Yeah, I had a question about item 5.6, which is the financial update. And question, I guess, for Jeff, if he's there, Jeff Goldberg. I was just wondering how the new financial update would affect our ability to set money aside for the financial reserves this year.
Thanks for that, Peter. So I think this will be a discussion for the Finance Committee when they meet in late April. But I think the recommendation we'll make for that committee is to use any surplus that we do have to fund the operating reserve. Because we're, as you know, we're underfunded in that. So this is a great opportunity to make some headway there.
I know there was some I guess, nervousness or anxiety about running a deficit this year and not being able to pay into that reserve. I think this improves things a little bit, if I'm not mistaken.
It does. It certainly does. And one of the big reasons for that is the performance of the investment portfolio. I think that's probably going down a little bit now, but at year end, it was really positive.
Thank you. And next on my list is Jack.
Thank you and good morning, all. This is a question about access to care. There is a symposium, a stakeholder meeting that is scheduled for April of this year. Can we know the date and the location, virtual or not? What's on the agenda? Who will be attending? That are the names of the attendees thus far? And will Council have an opportunity to attend this meeting?
Thank you. I can start, and then if Dan wants to add comments, he can. Thanks, Jack, for the question. We are going to be doing, and this is in accordance with Council's the proposal that you approved late last year. We're going to do 2 stakeholder meetings. The first is April 7th. It is going to be virtual. In terms of the representatives, we are going to have representatives from both faculties of dentistry. Jack, I don't have the full stakeholder list in front of me, but I can get that to you. So I don't have all the specific names, but if you're okay, I'll tell you sort of roughly who they are and representation. So we've got representatives from the faculties of dentistry. One name I do remember, of course, Dr. Carlos Quinones is joining us. We are going to have a representative from the ODA. We are going to be having representatives from 2 patient organizations who have joined us in the November 2019 symposium. So one will be representing the ODSP perspective, another is representing sort of a broader, is the Alliance for Healthier Communities. They represent a number of different more marginalized groups that would be accessing and have a need for these services. What's on the agenda is really, if you recall from the proposal, the intention here is for us to listen. We want to hear what work the different participants are either engaging in themselves to advance access to care or have planned. So current work, future work, so that we can really form a more updated sense of what the landscape is, recognizing that various organizations and individuals do work in this area. This is an opportunity to understand what's at play, who are the communities being supported, what are plans? And so, and additionally, I think a further objective is to think about how can we keep in touch with all of these individuals and other groups so that we can remain coordinated going forward. I can't remember if I said this, Jack. It is going to be virtual. So it's going to be a virtual roundtable. The same goes for the second meeting that we have planned as well. In terms of council representatives, Dan and I just chatted about this the other day. Yes, that's a possibility. We haven't wrapped our heads around sort of exactly how that will work. Dan may want to offer a few more comments, but yeah, the intention is I think it's going to be a really great opportunity for us as a college to really see what our system partners are doing and get an understanding of how we can contribute and yeah, learn from people doing great work in this area. So Dan, I don't know if you'd add anything to that.
Thanks, Andrea. The only thing that I would add for council is this is not a symposium. I know you used that word, Jack, and it's not a symposium as constructed in 2019, I believe. It is, as Andrea has described, it's really an opportunity to find out what's happening with limited numbers of people from different stakeholder groups. So obviously council is welcome to send an individual, to have an individual there. We're there to hear what other groups are doing, and hopefully there's conversation that allows different groups to see ways in which their work or directions might be complementary to each other, and possibly even allow for further discussions offline from that particular meeting. I would leave it to council to decide how you want to pick a representative that might be at that table to listen in. But that's really the design, and it's much different from perhaps, Jack, what you experienced and council experienced in 2019 for the symposium that this college created.
Well, thank you, Dan. I know it's a stakeholder meeting, and I'm not asking for council to participate, although it would be nice to have a representative who would participate, but I'm looking for a public viewing of it. In other words, we can publicly view the ongoing meeting. Not participate, but view.
Okay, thanks for that, Jack. To be honest, I hadn't really imagined. So are you describing something like what we do with council, sort of live stream it? Is that what you mean by public view? Okay, we can take that away. It's not something that was part of the design of it. And I'll need to just turn my mind to that, because we sort of invited people to participate without sort of telling them that was the approach. So I want to just, if it's okay, I want to just give some thought to that. But yeah, we can take that away and see what's possible. Dan, I don't know if you want to comment.
The other possibility is to record it and with the consent of the parties involved, and then make that recording sure. With limited access. We can provide a link to council members, but not necessarily provide it as a live stream or to all members of the public.
That would work.
Okay. Thanks for that, Jack. We'll take that away and think about what the options are and how it might work from a tech perspective. And of course, because people have already committed to the meeting, I'd want to make sure that they're comfortable with that. So yeah, thank you.
Thank you. Next on my list is Gildo.
Thank you, Hannah. Andrea, it's just a quick question for you. As you know, I'm the Associate Dean of Education in Schulich Dentistry. I don't remember if I am the one person representing my school at this meeting. And if not, I'd like to ask you to please include me on this list for a reason. Whatever comes from there comes through my office to prepare in advance for our education system at the school. So that will be helpful in preparing for my next academic year coming. And by the way, Carlos, he is gonna be our next dean here, starting on June 1st, in case the members of the committee, they don't know yet, okay? Thank you.
Thanks, Gildo. Just to let you know, the approach that we used, I reached out to both of the deans of the dental schools and asked them to name a representative. The representative that was named by Dr. Bertha Garcia was Dr. Abbas Jassani for Western. So I hope that works for you. And certainly there can be lots of information sharing, but I left that obviously to the faculties themselves.
We work together, so here we'll keep me posted. Thank you. Thank you.
Wonderful. Okay.
Thank you. Next on my list is Nancy.
Hi, good morning. Thank you. I just had a quick question in regards to the EDI action plan update. I noticed that the RCDS staff will be included in various webinars and training, and I wanted to know if there would be any possibility that council members would be invited to participate in ongoing training and webinars as well. Thank you.
So thanks, Nancy. And we haven't actually looked at ways to commingle council and staff and some of the training, and some of it might be more specific depending on the role that one plays in the organization. I can say to council, though, that we are also looking at how we can provide more training and more activity around equity, diversity, and inclusion for council, including things like the upcoming election in the fall, where we are actively trying to engage members of various parts of the province and various groups who may not participate, and how we can encourage more participation in that way. So there is training that we will be looking at and are looking at for council that might be separate from staff. We are looking at this as the holistic organization, not just staff. So stay tuned, and there will be more that we will talk about at the council table.
Thank you.
Thank you. And the last name on my list is David Mock.
There, it took me a moment to unmute. Just a quick comment for Andrea, and Gildo hit on it. I imagine Carlos was selected as the U of T person for input from the University of Toronto. As Gildo pointed out, they're lucky enough to get Carlos now as their new vice dean and director for the Faculty of Dentistry. So you may want to touch base with Dan again, and it'd be nice to get somebody from the clinical end of the faculty, because they are actually providers of access to care. Just a suggestion.
Thank you, David. Actually, Carlos is sort of our extra subject matter expert. He's not the U of T rep. Dan named Dr. Joel Rosenblum as the U of T rep. So we're covered there. We do have a U of T faculty rep as well as a Western one. And then Carlos is sort of an extra, just given, of course, the extensive research he's done in this area. He's one of our sort of extra subject matter experts.
Perfect. Thank you.
Okay.
Thank you for those questions and for the clarifications responding to them. I would now like to ask that the motion for the consent agenda be called up, please. And on your screen, you will see that the motion number 1 is that the following items be approved and or received for information by council. Approval of agenda, approval of RCDSO council meeting minutes, November 18th, 2021, approval of RCDSO special council meeting minutes, February 17th, 2022, registrar and CEO report, council evaluation survey results, November 18th, 2021, financial update, access to care update, COVID-19 update, college performance measurement framework update, equity, diversity, and inclusion action plan update, resignation of inquiries, complaints, and reports committee member, appointment of new chair of Commission on Dental Accreditation of Canada, response letter to Ministry of Health on governance reforms, February 23rd, 2022, 2022 work plan for council, and Ministry of Labor Training and Skill Development news release, February 3rd, 2022. And even though I've just asked you to please use your raise hand or chat function, since we are doing this live, we thought in the interest of optics and being open, well, I'm going to call this question now. I'm going to ask to have a mover. We are actually going to physically raise our hands in front of the computer so that I can scan the screens and the people watching will also be able to see the vote. So could I have a mover for that motion, please? I see David Bishop is moved. I see Brian Smith as a seconder. You see the motion. All those in favor, please physically raise your hand in front of your computer. Those opposed? Any abstaining? Thank you. The motion is carried. Now we're going to move on to the registrar and CEO's remarks. Included in the consent agenda was a written report from Dan. That can be found on pages 29 to 31 of your materials, but I am going to turn it over now to Dan to speak to his report. Dan, please.
Thank you very much, Hanno. And I have some slides that I want to take council through, and I know that I'm against the clock a little bit. If you could advance, Angelo. I just want to say that this has been an extremely busy time for the college, for the staff who support the work of the college every single day. Obviously, we have had many different things in the environment to deal with, and I'll talk a little bit about that in a moment. You've heard this morning the submission that was prepared on behalf of council and based on your feedback and input on February 17th at the special meeting. That was submitted on time. There's nothing new to report that's been made public or formal about the governance reforms or timing or anything to that degree. I know that there has been some discussion within the profession in terms of the governance reforms and what that might mean to self-regulation and regulation. And certainly we are keeping our ear to the ground about those conversations that are happening. But that's really where we are today in terms of the submission has gone, and we are in a bit of a watching pattern. There was obviously a surprise announcement to all of the regulators on February 28th that the government would be deregulating the College of Traditional Chinese Medicine Practitioners and Acupuncturists. And then 1 week later, the even more surprising announcement that they would not be deregulating that college. And as we have seen in some of the press releases, the rationale appears to be that there has been some headway made in terms of offering the licensure examination in languages other than the two official languages of Ontario in Mandarin and Cantonese. So stay tuned. There may be more information arising from the regulatory standpoint within Ontario, and I'll keep you posted on anything that I hear. Next slide. As has been mentioned several times today, council already knows that Dr. Carlos Quinones, who we all know and he presented to us last year, has been appointed as the Vice Dean and Director at the Schulich School of Medicine and Dentistry. I want to say publicly how much I was thrilled, and I know many of you were thrilled to hear this news, and to congratulate him on this incredible position that he's about to start in June. And we will be sending out a formal congratulations on behalf of council from myself and from the president. Next slide. I mentioned how busy we are, and I want to just talk a little bit about some of the things that walk in the door. And so on the slide, it's really an opportunity to kind of look at the various things that we deal with on a regular basis. You can see that COVID-19 in the middle box has taken up a very large amount of time for staff. From the guidance document that was developed in 2020 to many amendments and changes over the last year and a half that I've been here, issues that related to training restrictions and work that was done to try to understand those within both U of T and Western and try to help ensure that there was capacity for training and examinations and assessments. And on and on. And you can see a lot of the different elements that related to all of the experiences that we had over the last couple of years with respect to the pandemic and the COVID-19 virus. On the right-hand side is really a snapshot of a number of other things that have faced the college and the staff and council, from governance reforms, as you all know, which was a 4 or 5 week drop everything and have probably several staff involved almost full time for that time to pull together all of what you saw and contributed to in terms of the submission. On down through the college performance measurement framework, which involves many staff who for 3 months gather information to ensure that we are compliant with our reporting and also demonstrating to ourselves and others those areas where we are doing very well and those areas where we want to improve and will improve. And things that walk in the door like standards or the work that we do with our oral health care colleges on collaboration, the Ontario Fairness Commissioner that I'll speak to this afternoon, and on and on. Next slide. And the reason that I tell you this is we have a capacity and we always have to figure out how to match our staff capacity to the work that we have to do. And so you can see that first and foremost, we are here to fulfill statutory requirements, from registration to complaints to QA to discipline to facility inspection program. We also have the PLP program. So those are the things that are the bread and butter of RCDSO. We have to do them, we staff to it. We're fairly lean in all of those areas, and we've been working, as you know, with our regulatory programs, PCRA, the professional conduct and regulation area is really looking at its processes on a regular basis. And we're doing that soon with our facilities inspection program. And that's where many of our staff spend most of their days. As a modern organization, we also have a strategic plan. We have a very good strategic plan. I walked into my role with a strategic plan that was developed in 2019 that didn't anticipate COVID, and also had many of the elements of where modern regulation is going. So that was obviously a bonus for me. And obviously it was very aspirational. There were a lot of priorities. And as a modern organization, we want to make sure that we fulfill our commitment to moving forward. And so that's why we have a strategic plan. And I'll talk a little bit more, as Andrea will this afternoon, just about focus and how we want to use that strategic plan moving forward, but how we want to make sure that we are properly resourced, both to fulfill our regulatory mandate and also to fulfill moving forward as an organization. And finally, the unknown, the slide that I showed previously, all of those things that we still need capacity to do because we know they will happen. They happen on almost a weekly basis. And my whole point in saying this to you is just to acknowledge the 130 plus staff at RCDSO who are committed every day to fulfilling all of these responsibilities, and have also worked, as all of society has, under some really interesting and extreme circumstances over the last 2 years with the pandemic, both in terms of location, in terms of family life and personal life, and in terms of contracting the virus and sick days that we all experience, because we obviously are all part of the environment as well. And the areas that we still need to spend a lot more time on are things that relate to communications and stakeholder engagement and the development of standards that you as a council expect us to be doing and we want to do. And also, when we look at the unknown that comes in the door, how we do a critical risk assessment. What do we focus on? What do we not spend much time on? And many of the things on the previous slide are things that we have to spend our time on. So again, setting the stage for the strategic planning discussion that we will have today, and many other discussions that we'll have moving forward. Next slide. I want to just confirm with council that we have been approved by the Health Board Secretariat for an exceptional circumstance preparation time for public members of ICRC. That was something that we developed a proposal, and it was approved. There is a complex process that we go through now on a monthly basis, and we get approval if we still have the tremendous backlog that ICRC is dealing with. And we have been able to increase the preparation time for our public members. So very positive development in that regard, and that's been ongoing since January. The June meeting, we will see some different reports. We will be launching the report to the public on the college, and we will also at council receive the annual committee reports. It's an opportunity for all of the committees to tell council what they've been doing this past year. We have a new format for both. We'll be looking at the annual committee reports to be somewhat shorter, focus very briefly on their mandates, and also focus on challenges and accomplishments over the last year in 2021, and also looking at some data and comparisons using a consistent framework of comparisons. Our annual report that gets released to the public will also be different. We'll be using a different platform. We'll be looking at more of a story of what the college has experienced over the last year in 2021. It will include elements of committee, but it will also include many other elements that you as council hear about issues and that we as staff deal with on a regular basis. Our dashboard is something I'll show you a couple of slides on. We have, as you know, been focusing on strategic projects and the investigation timelines and backlog. In the future, we are looking at things that are important for council that relate to two other areas: facilities inspection program, which involves sedation and CT scanning in dental offices, and we'll also be looking at registration. I think the critical part for us and for you is to identify KPIs or key performance indicators that are meaningful. So that means that we'll be using indicators internally that help drive our programs and how we do our work. And we also need to look to indicators that are meaningful for you as governors. What do you care about? What do you want to focus on strategically? And that's why we've been providing the investigation backlog and timeline issues to you regularly, because that's a significant risk factor for the college. And we want you to be aware of the work that we're doing and the progress that we're making. Next slide. And I want to show you this quote that you've probably seen many times, but not everything that counts can be counted, and not everything that can be counted counts. So we can provide you with a lot of measures that aren't necessarily meaningful to you. We also have a number of different activities like access to care where we may not have quantitative measures that are as meaningful as we would like. And so this is what we are always striving to do. Next slide. This slide shows you again something that I hope you're familiar with. I believe I've used it over the last 3 meetings or 4 meetings. Our strategic projects, we continue to advance those. You've seen other documentation in the materials. We have 43 projects that have been at various stages over the last 3 years. We have completed 33% of those. I also have a slide around the case files, the active case files, and also the backlog issue. Next slide. Quickly, again, this is really a high-level overview of how we're doing on those projects. I know that there's much more detail within each project, and you can see some of that in the materials today and other meetings. And we will spend time on that, but this just gives you a high-level overview of where we are with the number of projects that have been reported to you, and those that are still in progress and those that are completed. Next slide. You can see from this chart that there is a changing level of open case files at PCRA and the committee, ICRC. If you focus on the right-hand side, October to January, there is a decline in those case files, both those that are categorized as low and moderate, and those that are categorized as moderate and high, and different forms of investigations that take place for those different types of complaints. You can also see that the number of active or open files has decreased by 11% from October to February or January 30th. So that's, again, good news. We will continue to show you the progression of open case files and the reduction based on a lot of hard work by our PCRA team and our committee, ICRC. Next slide. And this is, I think, an incredible picture of where we are. If you look at the bottom 3 lines, those represent case files that were opened in 2017, 2018, and 2019, and we are almost at 0. We've decreased by 64% those case files opened in those years since the end of October. And you can see that of those 3 years, there are only 22 remaining files. Again, a ton of work by the committee, a ton of work by staff to really move those through and get decisions from the committee. You can also see that our 2020 files, the blue line, are dropping. We'll continue to report on those. And as you can imagine, 2021 is either stabilizing or dropping. We're no longer adding open case files from 2021 now that we moved into the new calendar year. And we will be continuing to move forward with those files as well. I like to call this catch up and keep up. We're catching up with all the older files in a very dramatic way, and then we need to sustain it. We need to keep up with the new files that are coming in, both from 2021 and 2022. So you'll hear a lot more about that, but it's moving in the right direction. Next slide. I'm going to go over a few slides very quickly, not only because time for me is short, but also because I want to give you a more comprehensive overview at a later time. But I want to go back to something that I talked to council about, and that you as the dentists on council will know. Our annual survey asked a number of new questions of the profession. Today, I want to focus a little bit on service experience. You can see 6 questions that we asked dentists in the October to January renewal period. And we asked them really about their experience with their interactions with the college, and also the interactions with our website. Next slide. Why did we ask these? Well, for a number of reasons. One of the things that I heard many times, obviously positive comments about the college when I started to this point. And I also heard some things that were concerning in terms of how we were responsive. And so it was really an opportunity to gather a baseline, to understand what the dentist thought about the experience that they had when they tried to get some answers or some advice from the college, to identify ways to improve, to benchmark our current state, and to use those measures to actually support overtime comparisons, much like I've been trying to do with the backlog of cases. Next slide. This is based on an analysis midway through the annual renewal. So it's based only on 4,200 and change of respondents. We do have a data pool of almost 11,000 now. So we can do this analysis. We think 4,200 is fairly representative of the profession. But this is what the brief slides that I will show are based on. Next slide. You can see that overall of that entire population of 4,255, 64% said that the service experience is good or excellent. And obviously 36% were less than that, in fair, poor, or very poor. Next slide. When we slice this a different way, of the 1,916 who actually said they had a contact with the college in the last 12 months, 80% indicated that the service was good or excellent. So it does change depending on the population. Those who didn't have a contact in the last 12 months, were they basing it on something that occurred more than 12 months ago? Have they not contacted the college for valuable information because of an experience before? We don't know all of that, but I think it raises some questions for us to address. Next slide. Of those who provided a high, good or excellent response, we had 21 who provided written comments, but many of those comments were negative. Next slide. Of those, as you can imagine, who provided a lower rating, the majority of those comments were also negative. Next slide. This is just to show you that we have a massive spreadsheet of data now. And Michelle Tremblay, who's leading this work, has been able to look at and thematically base all of the comments, and also look at the tone, positive, neutral, or negative. Next slide. Here are some of the themes that we've heard from those who provided a high rating. Again, looking at things like the phone service, looking at things like emails and responsiveness, technology glitches that people experience, the need for policy guidance, communication issues in terms of clarity of our communications, or not necessarily receiving our emails. And again, I'm not suggesting that what we do is poor, but I'm suggesting that there are some areas that we can work on and that we are working on. Next slide. Again, very consistent. Even those who rated us poorly or positively, here are similar types of issues that have been raised with us. And next slide. We also asked about the website. Very quickly, it is about 68% saying good or excellent. We don't know what this means, though, and this is where we'll do some more work. Is this the website and just the general content? Is it the portal? Is it the public register? This is something that we didn't hone in on enough in the questions, but we're trying to gather more information about that. Next slide. And again, themes that came out of the website commentary. And next slide. again, consistent between the two different groups. And next slide. So why does this matter? Well, we now have a rich source of data in terms of how we are doing in the profession's eyes, a very cost-effective way of gathering data through the annual survey. We didn't have to do anything differently other than make sure that we were prepared with good questions, and we incorporated it into the survey that was going out at that particular time of year. We have an opportunity now to really try to appreciate the public's experience as well, and we need to do that in different ways with different methods. We have clear and usable information. So what have we done? Well, we're looking at our practice advisory service. We're looking at how we answer live calls more frequently. We have been able to use and tap into software for our phone system to really understand how calls are being abandoned, how calls are being moved around the building. We're sharing data with staff so that we can be improvement focused and really start to look at different ways that we can change our processes to provide that experience. We're looking at a website refresh. We're likely going to launch a new look website sometime in the summer, and it's going to look at design, it's going to look at content, it's going to look at navigation. We're also looking at how we prepare that content in terms of, is it clear, is it succinct? How we share that content with the profession through phone calls and the website, and really trying to tap into the culture of service of our staff. All of our staff want to provide a good service. And so how can we support staff to do that as effectively as possible? So again, we're prepared to talk to you a lot more about some of the data that we found. We have a whole other data set of issues that relate to what individuals are doing in their practice, and I'll come back to that in June. But this is a really rich data set that we want to use to improve as an organization. And next slide. And just a final comment, as being a new person, I had to scour the internet because I don't have historical photos that I've taken around the college, but probably these are LinkedIn pictures. I also want to echo what Sandy said earlier, and I want to publicly acknowledge two of our staff who will be leaving us at the end of March for a well-deserved retirement. Both Mike and Kevin have been incredible contributors to the college. Mike for more than 20 years, Kevin for 6 or 7 years. They have been hugely supportive of my onboarding in the organization, and they have contributed immensely to the public interest. And I want to take this opportunity to really wish them much success, great health, and a lot of fun in their retirement. And thank you, Council. I will take any questions.
Thank you very much for that, Dan. Okay, so what I'm going to do is right now I see Rod and David Bishop. I'm also going to ask for the rest of you to either use the raise hand function or the chat function. I'm aware of the fact that we have a guest who is going to be speaking to the next matter. So as they say, we will do Rod and David Bishop. Then I will maintain a list, which we will then defer to our other business so that we can move on with the next item. So Rod first, then David Bishop, and I will keep a speaker's list.
Hanno, thank you very much. Dan, first off, thank you, and just great news on that member survey. You know, I've been questioning and a big fan of that for a long period of time now, and I think you're off on an excellent start. My one question is, and this is normal in all surveys, do we plan to go back to the membership to share some of the results and also share our actions, and sort of, you know, keep chipping away at what their thoughts are as we implement these actions?
Absolutely. We're not at a point yet where we can provide this in a way to the profession or the public, but there's lots that you've heard and there's lots more, and we want to be able to package that up. We also want to be able to package what I haven't talked about today and what I'm just calling in my own mind dental practice in Ontario, because we have this incredible data set now on what dentists self-reported as you know, what they're doing in their practice. And so really trying to understand the scope of practice of dentistry. And so we are planning to go out. I don't have timing for you yet, Rod or Council, but we are planning to provide more communications to the profession about areas that I've talked to you about this morning.
Yeah, just another comment. I've never seen a survey that had upwards of 40% response. That's just that in itself is indicative of the need to do this further?
Well, Rod, just to be clear, we have 100% response. We may not have 100% response on all of those questions, but this was part of the annual renewal. And so members were providing us with information and paying their fee at the same time. And the profession really stepped up. There was really, I think, an appreciation for the kinds of questions we were asking and how we might use that data. And we'll be very clear with how we're going to use the data. But we're really, I reported today on 40% at November 30th, but by now we have almost the full profession who would have responded.
Yeah, no, I think this is excellent. I think it'll be viewed as also being very innovative across the board, all health regulatory bodies. So, and again, that's great. Thank you.
Thank you, Rod. David Bishop.
Thank you very much, Hanno. Dan, thank you very much for a very comprehensive update. But in particular, I'd like to say thank you on behalf of the public members for going to bat for us, for getting the extra time for the work that we need to do for the many panels that we're on. And we do appreciate that. Thank you.
Thank you. I do have a speakers list, which I will keep. And as I said, defer to either if we make up time to just before lunch. If not, we will do it in other business. So please keep a record of your question, and I will not forget to go to that. But I do feel we do have a guest. I would like to move on to the next item on the agenda, which is a report to Council on performance evaluation. The materials for that item are on pages 163 to 183 of your package meeting. And this is an item for Council's discussion. Joining us this morning is Sandy Verrecchia from Satori Consulting, who's been supporting Council in this work. Sandy is going to kick off this item by doing a short presentation. She'll be taking Council through the overall results of the Council member and Council effectiveness surveys. Council will then have a chance to discuss and share some reflections of your experience with the surveys. You will be divided into 4 breakout groups, and you'll be asked to reflect on 3 to 4 themes. Then following the breakout sessions, we'll come back to this main room. The assigned spokesperson from each breakout group will do a short report back to Council. Then Sandy Venditti will provide a few remarks to conclude this item. And don't worry, we're going to reinforce those instructions after Sandy Verrecchia's presentation. But at this point in time, I would like to welcome Sandy Verrecchia and turn it over to her. Sandy.
Thank you, Hanno. Let me just share my screen. And all right, so thank you very much for having me. And I just want to start off by thanking everyone for our one-on-one conversations. They've been great. Everybody's been very receptive, and some really great conversations that we've had there. So yeah, we have about an hour. We're going to go, as Hanno said, sharing the results, breakout groups, and then group sharing, and then Sandy will wrap us up. So in your package, there was, you may have seen when you were reading through it, you were probably wondering why on the peer scores, the numbers were so high. So I'm going to start really quickly there with how to read that. This is an example of a 12-person board where there was 12 raters rating 12 people. So a maximum score on any question for this particular board was 144, 12 times 12. So that's why these scores get so high here. And this, just so you can see, there's a matrix that goes. So Director 1 rated on a particular question 8 4 times, Director 2 several times, and it's the addition of those ratings that make those numbers so high. So in all, across all of those 12 people, 8 was rated 70 times. And so that's just to give you a really quick idea of why the scores may have looked a little weird on the peer evaluation, but it's just because there's so many people. So yours are considerably higher. So as we go through this, I want you to think about or consider what we might do differently as a council to be more effective. And just kind of tuck that question behind in your mind as we're going through these results. And then when you get into your breakout groups, it's about how can we be more effective in 4 particular areas that we've chosen to drill into today. So let's get into the results. There was a number of you that asked if there was a difference between the results of public members versus non-public members. So I wanted to quickly share this. There were some differences, but not large differences in how the public members are viewed across the competency roll-ups of values and behavior, relevant knowledge and skills and ability compared to the non-public members. So not huge swings by any means, but there was a slight difference. So when we look at the peer, so remember that we all everybody rated each other, and then we rolled up the results for the peer. So each of you got your own evaluation. The roll up of all those questions came here. These are the highest rated peer questions. So again, out of 10, so shy of 10, 9.55 in terms of complying with conflict of interest set out by the bylaws and the policy. So very good. Respectful of the contribution of committees and the work that they do. Very important that we're not tearing down what committees are doing, but we're adding to the value that they do when we bring it back to the council table. Demonstrating a good understanding of the role of chair, maintaining confidentiality, and ensuring that personal interests are parked at the door. So very strong results in terms of those very important governance pieces, especially on the personal interest and the public interest always coming first. So very strong governance practices there. In terms of the lower rated questions, and these are some of the things that we'll dig into a little bit in our groups, but actively seeking ways to improve council and committee performance was your lowest at a 7.21. And we should always be looking forward to, how can we do things better and how can we do things differently that's going to add efficiency or time or whatever it might be. Making a valuable contribution to the functioning of the council. So in terms of values and behavior was another lower one at 7.28. And that really comes into, our people speaking enough at the council table and adding enough value there. Actively participating in meetings with a good balance of listening, thinking, and talking, very similar to the one above, is at a 7.38. But just really speaking to, are we talking enough? Are we adding enough value? Are we listening? Are we talking too much at the council table? Again, next one is it's really about communication. So openly offering broad views on subject matters. Again, a lower one at 7.79. And then appropriately questioning management. So you can see that all of these, with the exception of the first question there, are all really around communication at the board table. And are we effectively communicating, asking the right questions, holding management to account at the board table? When we look at the council effectiveness, so there was two pieces of the survey. One was the peer, and then we rated the overall effectiveness of the council. The first question, again, the highest rated. This is your effective use of in-camera. It's a very long question, but to sum it up, that is, are we using it for the right reasons? And are we spending the right amount of time there? So overall, the council believes that you are, that at a 9.33. The council always regulates and acts independently and in the interest of the patients and of the public, which is important. They're very high at a 8.96. The number of meetings are frequent enough to ensure good governance. The council is demonstrating a positive tone and engaging in conversations relative to diversity, equity, and inclusion. And the current committee structure adds value to the governance of the council. So those are your highest rated overall council effectiveness questions. Your lower ones then is, are we effectively monitoring our CEO performance against broad objectives and overall management of the organization on a regular basis? So maybe some work to be done there, or at least a conversation about what does that look like? Newly elected or appointed councils receive adequate orientation. There seems to be a need to kind of beef up the council council onboarding. The council has the strength and depth to steer in a either with a CEO sudden CEO resignation or something that happens. So I think pandemic, nobody really saw that coming. Do we have enough bench strength to steer the college? So maybe some conversations there. As a council, we engage in an appropriate amount of council management debate before making decisions. Again, that goes back to that communication we talked to as lower on the other, on the peer question. And as council, we continue to evaluate our activity to improve our effectiveness. Well, that one's a little bit lower, but you're doing it now. So it's kind of what's the next steps on that. So, you know, a smattering of different things in terms of board effectiveness of probably just deserving of a few more conversations. So those are the overall results, which I know that you've already read. Hannah was going to take us into some breakout groups. I'm just going to share with you quickly what the questions are. Breakout group number 1 is, what suggestions do you have to ensure more council members have a voice at the table? So talking about that communication piece. Group number 2, what suggestions do you have to support council relationships building as we continue to use virtual platforms more fully than we did before COVID? And so again, how do we build relationships when we're not seeing each other all the time? Breakout 3, with tight agendas and limited time, how do you suggest we ensure that as council, we are spending the appropriate time on strategy and risk and fulfilling our fiduciary duty to ask questions and to ensure the organization is fundamentally moving in the right direction? So a big question to unpack there. And number 4 is, what suggestions do you have for a stronger new council member orientation? So how can we make our onboarding stronger? And so those are the 15-minute breakout groups that we're going into.
Thank you very much, Sandy. So now it is time for the council's decision. And just to give you a quick overview of how this is going to work, you've seen that you have been divided into 4 breakout groups. A spokesperson has been assigned for each group, as has a note taker, who I believe is going to be a member of staff. You will have about 15 minutes to discuss a few themes or issues that arose out of the evaluations and the question you have been assigned. We will then gather back here in the virtual room to have between 20 to 30 minutes of sharing and discussion. As part of that, spokespeople from each breakout group will be asked to share the reflections and thoughts of your group. During our breakout sessions, the formal meeting of council will be suspended. This will allow allow us to break council into smaller groups for the purpose of discussion. Council members, we will be moving you into your breakout rooms momentarily. For staff and all those joining by YouTube, please don't go anywhere. One of the breakout sessions will take place in this main virtual room, and you will have the opportunity to continue observing this informal conversation. So thank you, everyone, and I'm going to turn it over now to the tech gurus to make the appropriate moves.
I think you have everyone now, Alan.
Okay. All right. Well, thank you, tech gurus. So I guess
I was going to say, I probably didn't get moved. I was supposed to be in 4.
Well, can someone help with that?
Yep, please. Peter, just stay here for now. I'll see if somebody can move you. Or if you want to stay, that's fine too.
You can add Peter. All right. Well, thank you, everyone. I guess you've all read the question here, and I'll just reread it once. I think what we're going to do in consideration of time is we'll go through the 5 of us and give everyone 1 minute to just provide any answers or comment, and then we'll save the last 10 minutes for discussion. And then so you can discuss any one of the 5 comments that were raised. So I'll read the question to start. With tight agendas and limited time, how do you suggest we ensure that as council, we are spending the appropriate time on energy and risk and fulfilling our fiduciary duty to ask questions to ensure the organization is moving in the right direction. I assume appropriate time on strategy and risk means assessing and mitigating risk, not creating risk. So that's the question. And why don't we go alphabetically? So we'll go Amelia, Ben, Brian, Jack, Rod. You have 1 minute to make some comments, and then we'll save the last 10 minutes for discussion. So let's start. Amelia, you're on. Oh, sorry, I think you're on mute.
Can I go after? I want to give it a few minutes to think about that.
Okay. Let's go down to the next. Ben.
Thank you, Alan. As council has discussed before, we talked about the concept of something called a risk register. So in order to anticipate problems, we have to prioritize and list the risks to our organization. So I know we have created a risk register. I think we should periodically review this risk register by council so that we can know what is important to focus on. Thank you.
Okay, thanks, Ben. Brian, you're up.
Good morning. I think I get the feeling as a public member and fairly new to council that we have been, because of COVID and other things, playing a lot of catch up. But there has been, as Dan's report to us today pointed out, there's a lot of very good things happening with respect to communication to the membership, to our members of the groups. And I think we should encourage that going forward. I really think that some of the suggestions that we're going to speak about will provide more of an opportunity for council as a whole to chat like this, or even in groups, and come back together as we're doing today. I think it's important that we're served very, very well by staff. I think we're blessed to have such excellent staff, but I think we've got to show our support as I think we do, and make sure that we as a council are moving forward as well. Thank you.
Okay, thanks, Brian. Jeff, are we leaving you enough time to take notes? Sorry, are you okay there?
I'm doing my best. So, just go ahead with the conversation. I'll try and I have a backup plan as well. So no worries.
All right, Jack.
Can you ask the question once more, Alan? I just want to make sure I've got the details.
Sure. With tight agendas and limited time, how do you suggest we ensure that as a council, we are spending the appropriate time on strategy and risk and fulfilling our fiduciary duty to ask questions to ensure the organization is moving in the right direction?
See, one of the major problems I have with council meetings is the lack of preparation. And that's not necessarily the fault of the councillors. For instance, I look at it from the ICRC committee perspective, and we have, 2 days, now we have 2.5 days to prepare before we can actually sit down and discuss a file, a complaint. Some council members are more diligent and they'll read. But more than that, they'll do some research into various things. Like I didn't have enough time to research various organizations like the CPSO and so on, like the different regulatory bodies throughout Canada about some of the things today, but I normally would. So I think a lot of it is having time, and maybe we have to pay or encourage somehow. And it's hard because you need the right individual to do the research, because before we walk in, we should have a good understanding of each and every issue. And I think a lot of the people on council, and no disrespect, really aren't all that informed. And it's hard to really talk about issues or talk about the governance or how things are doing if we don't have that. So I think that's an important thing. Communications, I totally agree with. We have to communicate. you can't do it very well virtually, not in a big group when there's 30 members or 29 members on camera. So that has to change either in smaller groups like this or whatever. I think that's important too.
Yeah, good. Thanks, Jack. Rod.
Some of it's already been hit on. I think Jack's comments were particularly relevant. It's to say that there is an issue today. I guess I probably want to define what you think the issue is. Are we not addressing strategy and risk? And I feel we are, but if we had to improve, this is probably a function, and as Jack said, of the unwieldiness of council at the moment. And the future, where we're supposed to be going down to 12, will help in some way. But in the meantime, the challenges are probably the need to prioritize, as Jack said, the need to prepare, the appropriate skills being at the table at the right time, and the right information and research to go into that. So how do you balance all that? Other organizations sometimes establish subcommittee working groups, maybe risk and strategy working group, and they hold focus workshops, and then they develop a report that's prioritized and tackles the main issues that in highest probability, highest impact, and then actions recommended, and then reports back to council on a regular basis, and then the discussion becomes more concentrated and specific, and it's researched at that point in time, and the appropriate data is there. So that might be one way of doing it. I know that involves more time and more commitment, but these are important items. I think it might be worthwhile.
Yep, good points. Okay, thank you, Rod. Amelia.
Right. I know many of us have onerous schedules, but I'd like to see more informal, smaller meetings, whether in person or in line, to discuss many of the issues at hand, versus a larger formal meeting like we have today, with everyone present.
Right. Okay. Okay, thank you, Amelia. So we have 10 minutes. So I'll just open up the floor for discussion. You can anyone just feel free to choose to jump right in. We don't need to raise hands. So we had 5 really good points. So any discussion?
Well, I guess the thing is, are we rearranging the deck chairs on the Titanic at this point? Because the whole governance model, the whole council model might be thrown out come the new year. And so it's nice if we are still using the same model, but as Rod said, when we go down, if we go down to 10 or 12 board members, with the skills that they bring to the table, is going to be a lot different than 29 individuals with varied skills.
Yeah, that's an issue. If we, sorry, Dan, did you want to say something?
Yeah, sorry, I'm not going to say much, but I think just to add context, the question's generic enough where it doesn't matter if it's the current form of 25 members or a new form of 10 members. How do you spend your time as a board on the right issues? And this has been obviously a back and forth and a learning experience for me in terms of working with a new council for 1.5 years and what issues should come and what issues are management. And Sandy and I have had a lot of discussions about that. So it's making sure that you as a council feel very comfortable with the strategic and risk mitigation role that you have, and not necessarily having to know everything or at a level of detail. So yeah, I just want to make that context remark that it doesn't matter the size of the board or what the model looks like. This is a really pertinent question.
Yeah. So just to add to that, maybe I'll ask this question. Now that we meet via Zoom and Zoom seems to be the preferred way, is there something with a Zoom meeting that goes against basically the comments that you all made in terms of the volume of material that we have to deal with and the ability to communicate with each other, which in a large Zoom meeting it's harder to do that. So the question is, the Zoom medium, is that deterring us from meeting, I think what you said, dealing with the volume of material and the ability to communicate with each other? Is Zoom not the proper medium for that?
I think Zoom's great. I think it's extremely efficient. They're easy to get, you don't have to go to you don't have to go down to the college. I think it's a great way. I love it.
Yeah, personally, I think Zoom has its place, and it'll
Yes.
continue. But I'll tell you, in meetings in the past, whether it's provincial meetings or what have you, the most meetings I have, the most lobbying is done in the bathroom, and at coffee breaks, and that's where you get to know people and you discuss the issues on a one-to-one or in a smaller group, as we just discussed before. When you're in a formal meeting, it's more difficult to discuss issues.
So no bathroom in the Zoom meeting. So
no, and that's the problem with Zoom. You can't have these small meetings, except what we're doing now, and even then, it's difficult.
So does that affect communication amongst members, council members?
I believe it does.
I would agree with Jack's comments, Nayland. It's a different world, and it's harder to communicate. Some folks I wouldn't even know if except for Zoom, and it's very hard to get a feel that's similar to what you're used to in other organizations pre-COVID and so on. So I think it's not the best in the world such situation, but I think we're making the best of it.
So
let me add my 2 words too for a minute.
Yeah, go ahead, Rob.
The survey we just went through, I'm not sure if anybody else, I talked to the surveyor and mentioned that I was having trouble making assessments and answering the questions of some of my fellow colleagues. And part of it is because of our only points of interaction to 29 people. It has been Zoom over the last 2 years. So I think, developing a relationship is important, and physical interaction at some point in order to have a better relationship with which to assess each other is critical.
I think it's a good idea. Sorry. John, go ahead. I just think I see your points. I think you have a combination of the two would be a good idea. All Zoom, but not all in person. But combination.
I agree with you.
Nayland, I just want to kind of steer you back to the question, which is how do you ensure that you're spending the appropriate time on the right issues, regardless of medium? But how do we make sure that we're asking enough risk-based questions and asking enough strategic questions and spending the right time on the right issues to ensure that you get to the right answer, so that your fiduciary duty of asking questions and making sure that you're satisfied is satisfied?
So is there something, maybe to add to that, is something in the process with how we deal with stuff interfering with our ability to do that, assess strategy and risk?
Are you asking me? No.
Well, I think the points that people brought up that, in terms of the volume, Jack's point of preparation, Brian's point of communication, like it's hard to get those intense discussions when 30 people are at a Zoom meeting.
Mm-hmm.
Is that interfering with council being able to do its work?
And maybe we have to ask ourselves the question, are we really beating ourselves up here for the good work that we have been able to achieve? I think things can always be improved, but again, I come back to, given the time and the circumstances, and as Rod said, we haven't ever been together in the last two years plus. I think we've done very, very well. And so, let's keep things in perspective.
Yeah, and that's a good point, Brian. It may be low in the scoring, our scoring for the council, but compared to other groups, it may be very high. So it's relative. I think we've done a good job, certainly under the circumstances in the last couple of years. We have done well, and I think we've handled the risks and the strategies very well.
And the working relationship that Dan, being new to the organization, and all the staff, and Sandy and her new role, when you take all of that into account, it's really, really wonderful what's been accomplished. And I think we just got to build on that, not take it for granted, but encourage and support all of us in our efforts.
I think a lot of the difficulty, and I hope Dan can comment on this. A lot of the difficulty is that government will dictates a lot of what we have to do. Like, for instance, the College Performance Measurement Framework, or this recent governance reform review commentary, as well as directives from the Chief Medical Officer of Health. Some of these things come down last minute, and some of them come with their own deadlines, which makes things very, very difficult. So I just wanted to hear from Dan himself. Is there a role for us, for the college, to have some sort of surge capacity or some sort of buffer so that when these things come down, we're better able to respond to it?
Yeah, I mean, I think, and that was, Ben, the point I was trying to make this morning too, that surge capacity, because we know these things will always happen. And, we are a creature of statute. And I don't think we can get around the fact that there will always be different things coming from government that we have to respond to or react to. And it won't always be just because of RCDSO, because we share a statute with 25 other colleges. We share a mandate with many other parts of the sector, different sectors, education, accountants, lawyers. So, I mean, I think it's having that capacity to be able to respond, and we will. And I think I said this to council on February 17th. We will put the resources into responding to governance reform and the tight timelines. That's not the way we want to work all the time, though. But we can have the ability to drop everything and go. And we did that. But I don't want the staff to be doing that frequently or routinely. So it's a very interesting discussion in terms of what you as a council should focus on, and your comfort level, Jack, to your point, to be able to have those conversations in the format in which the statute has designed, which is around a big table or a virtual table in a public setting, and you're having those discussions and feeling comfortable about having them and saying what you want and landing on decisions. And there's no magic bullet solution or formula to this. It's just the conversations that we're having now and need to continue to have to get your feedback about how to do that as effectively as we can.
Dan, my experience, strategy and risk work is hard work, very hard work. And I know there's stuff that's on the table, but a lot of the good value I've been a part of in the past comes through hard-nosed, roll up your shirt sleeves, sit around the table with the right people, workshops where you put it on the board and you debate it and you bring up the appropriate data and you prioritize it, and then you get consensus. And I mean, sitting around a 29 or 25 member council, people tend to be comments, but they're time restricted, and there's not an opportunity to debate and really workshop it and come up with the solution. So, back to my comment on the need for some sort of, a little more detailed working group committee that deals appropriately with the right level of strategy and risk topic. But, you've got to create the opportunities to, to roll up the shirt sleeves and really debate this in a meaningful fashion. So, because stuff doesn't just come out, it gets debated, it gets decided upon, it gets, what happens in those sessions. So. And I find those are the most effective, and you get the most buy-in by doing that as well. So,
and Rod, do you feel we don't have the proper amount of time, or
do
that now at council meetings?
For this type of topic, strategy and risk, no. I think you want to engage us, but engage us, on the top level stuff that you need input on, that drives agendas and is the highest probability and highest impact stuff. I don't think we go through that in the level of detail. If you want our input, then the way to get it is we have to engage, and we have to crawl into the detail at that appropriate level, and then get in a room and bang it out, and then report back to council or some appropriate mechanism.
You were talking about that earlier. We were talking about focus groups and so on, but it's got to be more than just one group. We did the governance focus group, and we've had task forces in the past. But the council, even though we have a governance focus group, the councillors don't feel they're really part of it. Although they're open, they're giving us information. I think what we need are smaller focus groups for those councillors. We're 29, so we may need a number of them.
Yeah, I agree, Jack. Yeah.
Interested, and talk about it in smaller groups. Again, the whole key is smaller groups. You can't do it, and I think we all agree when there's 29.
Jack, I agree. That subcommittee, I agree, it's no more than, I don't know, 4 to 6 people.
That's plenty.
Yeah.
But we don't have that opportunity, and most of it, unfortunately, not unfortunately, wrong word, is staff driven. Does the staff have the time and the expertise to put together the strategy and risk, and then it's presented to the council a week before or 2 weeks before as a report, and that's all we have.
I agree, Jack. If they want us to engage, it's more than just presenting to us. It's getting constructive feedback on through some sort of a subcommittee engagement. So,
yeah.
Okay. Any other comments?
Just a heads up that the groups will be returning to us momentarily.
Okay.
Thank you, Hanno.
Maybe I can pitch in for 1 second.
Sure.
There might be an opportunity for some of these subgroups to go down to the committee level as well. For example, the audit committee will be dealing with risks. So that might be one area where we can use 5 to 6 people to discuss some of those issues. So
the only problem I have with that, Jeffrey, is that they're not just strictly council members. Oh, sorry, I guess we're back.
Angelo, I'm just wondering if I can ask you to let me know when everyone is back in the main room.
I think we're still waiting for a few folks, Hanno.
Okay, thank you.
I think it looks like we have everyone now.
Thank you so much. Welcome back, everyone. We are now going to resume the formal part of the meeting again. And what we're going to do for the next 20 minutes is ask the spokesperson from each group to sort of share some of the highlights of your discussion. Please rest assured that notes were being taken. So if you do not have the opportunity to verbally express what your committee talked about or your group talked about, rather, that information will still be there and will be collated and will move forward. So I'm going to give each group about 5 minutes to talk. What I'm going to do is I'm going to start with group 1. I'm going to ask you to just reread the question so that the rest of the people on this call remember what your question was and then share in a few minutes just some of the highlights from your group. So I'm going to start with group 1, please.
Who is group 1?
I think that was your group, Nalan.
Oh, okay. Sorry. Thank you, Hanno. So I'll just reread the question. Question is, with tight agendas and limited time, how do you suggest we ensure that as a council, we are spending the appropriate time on strategy and risk and fulfilling our fiduciary duty to ask questions to ensure the organization is moving in the right direction? So long question, but basically it comes down to this: strategy and risk. How does council prepare themselves to ask questions so that we can appropriately deal with strategy and risk? So the group discussion quartered around two big themes, and under those were some sub-themes. 2 big themes are arming. How do we arm the council so that when they come to council meetings, they can deal with strategy and risk? And 2, definitions. How do we define strategy and risk? So I'll deal with the first one first, arming. There was 3 sub-issues: volume, the amount of material that goes through council meetings. Is the volume of material too much, too large to deal with at these council meetings? Two, and this was a big one, communication. With large Zoom groups, did we feel that we could communicate effectively and, as someone said, roll up your sleeves and have these intense discussions where we can get to the base of some of these strategy and risk questions? And three, the importance of preparation. It was important that council members prepare themselves so that they're armed to deal with strategy and risk. Okay. The second subgroup was definitions, defining. One suggestion was to have a risk register where we could list possible situations, possible upcoming events, so we could, have a list of things that we have to deal with. And two, is there an issue with strategy and risk? So can we define that? Is there a problem? Do we have a problem right now with specific areas of strategy and risk? So to just summarize, two things: how do we arm council to deal with this? And two, can we define so we have a clear idea of the issue we're facing? Okay, thank you.
Thank you very much, Nalan. I'm going to ask the spokesperson from Group 2 to recap your question and then provide some highlights from your group, please.
Thank you. So our question was, what suggestions do you have to support council relationship building as we continue using virtual platforms more fully than pre-COVID? So we discussed in our meeting, in our group, that initially our virtual platform started out as a response to COVID, but now it's morphed into a more financially prudent means of communication. But we all felt that a hybrid model would be the best way to strengthen relationship building. So perhaps to consider part virtual, part in person. The other thought that we had was perhaps prior to our council meetings, if there were other ways of communication that we could be broken down into smaller groups and perhaps discuss certain components of the council package ahead of the meeting. So that way it would give us the opportunity to discuss it thoroughly, have a be more intentional in our communications during our virtual meetings, and we would be therefore more prepared for our council sessions. So the question arose, well, how do you divide up the council members? Do you divide them in groups of 8, groups of 7, smaller groups so that there's more engagement? Compensation for prep time. When do you create that time? Is it 2 or 3 weeks prior to our council meeting? So these were some of the questions that were arisen out of our conversation. I think in that manner, we felt that, again, a more hybrid model in smaller groups and breaking up certain components of the package material would probably be the best way to strengthen our relationships.
Thank you very much, Nancy. I'm going to ask the spokesperson from Group 3 to please recap your question and then provide some highlights from your group's discussion. And I'm not sure who that person in Group 3 is.
I'm not sure if I'm Group 3 or not.
You must go for it, Joseph.
Okay. So the question that we had was, what suggestions do you have to ensure more council members have a voice at the table? So we had a robust discussion in our group on several issues. One concern came up with the legislative proposals of the government and reducing the size of council. Definitely some concerns about having with less members, less council members, ensuring that they have a more representative voice. It will pose some challenges and it will pose some difficulties. So we're dealing in a potentially challenging environment, and that's some context that was added to the discussion that is very important to consider. In terms of how our current members can have more of a voice at council meetings, the fundamental aspect that kind of rang through was the need to really develop more opportunities for us to have comfort with one another about, and it's really about relationship building. So some of the similar themes that Nancy brought up about having different opportunities to talk about the issues that are being brought to council in different forums. For instance, the breakout groups like the one that we just had was a fabulous opportunity to hear some comments that you might not necessarily hear in a broader council meeting. So finding agenda items where you can take a big item and kind of dissect it into smaller ones, go into breakouts, that would allow more council members to have a greater voice. Also having opportunities for council members to comment on issues after a meeting. Maybe they weren't given that opportunity or didn't feel comfortable necessarily raising an issue during a meeting for whatever reason. But if there is opportunity for post-meeting follow-up or post-meeting, breakout room or something of that nature, then maybe some other comments would be able to be gleaned by Dan or Sandy, etc. So that was another area that people were definitely looking at, as well as social opportunities now that restrictions seem to be lifting, whether there are social opportunities for us to get together through a dinner or other aspects like that. That would be a opportunity to build relationships within or amongst council members, which would enhance our comfort levels at council meetings. That was also raised. And being more conscious of inviting comments from persons who perhaps haven't been heard. And that can happen both within a breakout group as well as a committee level. So that is also being more proactive in making sure that we hear from everyone around the table. I believe that is it.
Thank you very much, Joseph. And could I please have the spokesperson for the last group recap the question, your question rather, and share some of the comments or highlights from the comments your group made?
Hey, everybody. So our question was, what suggestions do you have for a stronger new council member orientation? This was another great question, actually. Obviously, very pertinent to me because I'm the new guy around too. So, but we had some very good points. Number one, first point was to pair new council members with an experienced council member for peer mentorship. There were points around Zoom training and other IT training, EDI training and unconscious bias training as well, including terminology. So just training in general. We like the general orientation sessions for council around diversity and communication, but we thought that some of the committees needed more onboarding, such as, and we gave an example of the discipline committee. Some of the suggestions were to have mock cases or scenarios for the different discipline sessions, or to have like an ICRC session with a different, a chance to observe experienced peoples in their roles. So different council members, what they would do in their, or what they've done previously. As well, some recommendations around providing access to existing training videos of different mock hearings. There was a CD that was also created previously as well, but perhaps it's time to look at that as well and perhaps rebuild on that. ICRC has actual mock panels at orientation, which was very helpful, but possibly creating some sort of consistency between different committees and as that would relate to, for instance, registration or discipline. We also discussed why the some of the IT standards for different committees were different. So for example, some require Citrix, some don't. And perhaps creating some sort of one portal would be best to use. That's obviously secure and meets all the requirements. And then we had a very good discussion around needing to understand where new members are in the spectrum of competencies, and then to clearly communicate what is expected by their colleagues and the college to them. So basically having some sort of baseline expectation and then an opportunity where necessary to enhance those competencies. So that kind of needs some sort of analysis between candidates. Obviously, you know what your baseline is, and then to develop some sort of fundamental competencies need to be established, and then to define a gap between what their baseline competencies are and where they need to get to, and then they need to do some sort of individual enhancement of their competencies where required. And then we also brought up a point around when someone starts midway through like their term, what is being done to bring those people up to speed so that they're kind of not falling through the cracks in terms of jumping into, let's say, an ICRC committee or a discipline committee meeting fresh.
Great. Thank you so much, Osama. I would also like to thank everyone for your thoughtful and considered comments in this exercise. Please remember that not only these comments that you've made in front of us all, but the notes that you did in your groups will all be combined and will be moving forward for staff to deal with. At this point in time, I would like to turn it back over to Sandy Venditti for some concluding remarks.
Thank you, Hanno. And thank you, Sandy and Council, for the discussion and feedback on this item. I just wanted to offer some thoughts on what's happening in terms of the next steps. So in April, as part of our ongoing commitment to board development and in line with our strategic plan, we will be having an interactive session hosted by Darcy Delamere, who you may have remembered from last year's orientation. So Darcy will speak to us about board culture and more specifically focus on communication and our engagement with each other. The objective is to come away with a set of RCDSO council rules of engagement and expectations around meetings and council input. This will further ensure that we invest our time wisely at each meeting and continue to add value to the organization. They're really important building blocks in our work together and ensuring that our meetings are focused and effective. It will also serve as a great addition to our orientation program. So thank you again, Council, and I'll turn it back to you, Hanno.
Thanks, Sandy. So that was great discussion. And the good news is we're also keeping on board as far as our timelines are concerned. So it's like a win-win situation. I am going to ask for a 15-minute break now. So it's now 10:44. I'm going to suggest we return at 11 o'clock. Council members, please remember, while you step away from your computer for your break, just mute yourself, turn off your video. We've got a 15-minute break and we will reconvene at 11 o'clock. Thank you all. Thank you all. I think we are ready to begin. Thank you. The next item on our agenda is a conflict of interest. The materials for that item will be found on pages 184 to 210 of your package. This item is for Council's decision. Council will be asked to consider and approve proposed bylaw amendments related to conflicts of interest. We have 4 motions for this item. Sandy is going to take Council through the materials, and then we will deal with the motions. So Sandy, I'm going to turn it over to you.
Thank you, Hanno. So as Hanno stated, we have some proposed directions and bylaw amendments regarding conflict of interest for your consideration and approval. Given the recent consultation by the government on governance reform, we are at a critical juncture with respect to governance, and it continues to hold a very great deal of importance for our college. We know that sweeping legislative changes lie ahead, that competency-based appointments and education are the future, and that heightened focus on conflict of interest and governing in the public interest will continue. So these changes are intended to enhance both board performance and accountability. Next slide, please. So in today's presentation, I will provide you with some background and remind you the why. Why did we embark on this work? Then we will discuss and make a decision on the various proposed bylaw amendments, and then finally walk you through next steps in terms of implementation. Next slide, please. So in terms of background, I will give you a brief refresher. In 2020, the Ontario Ministry of Health introduced the CPMF, which is the College Performance Measurement Framework, and it set out common measures for Ontario regulatory colleges in order to drive performance and increase accountability. So the second standard relates to conflict of interest, and it requires that the college demonstrate how council decisions are made in the public interest. The ministry's summary report, which was released in September of 2021, acknowledged our college's work for several commendable practices. And it also indicated that colleges made commitments to improve transparent and accessible communication of council members' conflict of interest declarations. Protection against conflicts of interest is important for regulators. Those engaged in the college's work have a duty to carry out their responsibilities in a manner that serves and protects the public interest, and to maintain the trust and confidence of the public in the college's decision-making process. Next slide, please. So conflict of interest, it's council, committees, and other professionals engaged in the college's work must not engage in or be perceived to have engaged in any activities or in decision-making concerning any matters where they have a direct or indirect personal, private, professional, or financial interest while performing their duties. Next slide. So in terms of where we are now, the college has bylaw provisions pertaining to conflict of interest. Today, council is being asked to consider and approve several proposed bylaw amendments pertaining to conflict of interest. Next slide. So the first proposed amendment pertains to council and committee eligibility criteria and the broadening of the language around holding responsible positions in organizations or groups with conflicting mandates. So currently we have bylaws 7, 8, and 9, which contain provisions regarding members holding positions in organizations identified as either national or provincial. So what we are proposing here is replacing that language with a general catch-all provision. A conflict would arise if one is holding a position of responsibility in any organization and or group whose mandate or interest conflict with the college. So this would include holding a position of responsibility in an international association. We had this issue during our last election cycle, or a responsible position with an anti-regulation group, which a reasonable person would assume or conclude that would be at odds with our public protection mandate. So the proposed amendment before you basically casts a wider net and is intended to provide clarity for registrants interested in serving as a council or a non-council member. So therefore, you are being asked to consider approving bylaw amendment to paragraph G and the revocation of paragraph G.1 of the three relevant bylaws, which is Articles 7.2.4, 8.1.1, and 9.2.1. So these are summarized in recommendation number 1 on the next slide. And these changes would go into force immediately, as we are not required to circulate these types of amendments for consultation. So at this point, I will turn it over to Hanno. He will lead the discussion on this amendment, read the motion, and take the vote. Hanno?
Thank you very much, Sandy. So you see the motion in front of you now, motion number 2A, that council approves the proposed amendment to paragraph G and the revocation of paragraph G.1 in Articles 7, 8, and 9 as set out in Appendix B, pertaining to broadening language regarding holding positions of responsibility in conflict organizations/groups, such amendment to take effect immediately. And I'm going to look for a mover to that motion, please. Moved by Vivian, seconded by Brian. And if there are questions or concerns, we will take them now before I call the vote. So Brian, I see your hand is up. Question? Brian, you're muted.
My apologies. I hadn't removed my hand from the screen.
Oh, okay. So any questions? I'm not seeing any, so I will remind you that since this is a motion dealing with the bylaw, we are going to require a 2/3 majority. 24 members of council are at attendance or in attendance at the meeting today. So according to my calculations, we would be looking for a minimum of 16 votes in order for this motion to move forward. What I am going to do when I call the question is ask for your patience. Please raise your hand visibly or physically in front of your computer. I will count, as will Angie, to ensure that we have the correct number in order for this motion to be carried. So the motion was on the screen. If all those in favor of the motion, please raise your hand and leave it raised in front of you until I ask you to lower it. Thank you. I have 24. Did you get that number as well, Angie?
Yes, I counted 24.
Thank you. So in that case, that motion is carried. And Sandy, I'm turning it back to you.
Thank you, Hanno. So the second proposed amendment is regarding the cooling off period. So what we're talking about is what is the appropriate minimum amount of time before an individual can serve on council or sit on a committee after holding an office or a position of responsibility in any organization and or group whose mandate or interests conflict with the college. The cooling off period is intended to provide a window of time to allow the member to distance themselves from their profession-oriented decision-making and shift to making decisions in the public interest. Currently, our bylaws 7, 8, and 9 require a cooling off period of 2 years. The executive committee supported the idea of expanding this cooling off period by an additional year to 3 years, in keeping with current leading practice, which is the recommendation given by Sir Harry Caton, and also to align with one of our other eligibility cooling off periods around dental consultants. Since our election cycle is 2 years in length, prospective council or committee members would now be required to wait 4 years before seeking nomination or appointment with the college. The executive committee supported the idea of the cooling off period changing from 2 years to 3. And again, these changes would go into effect immediately as they do not require circulation. So Hanno, back over to you.
Thank you, Sandy. So if I could, the second motion is on the screen in front of you now. It's motion number 2B, that council approves the proposed amendment to paragraph G in Articles 7, 8, and 9 as set out in Appendix B, pertaining to expanding the cooling off period from 2 to 3 years, such amendment to take effect immediately. So at this point in time, I would call to have someone as a mover. I see Ram hand up and Jack as a seconder. If you have questions or comments to make, I would invite you to do so now, please. Judy. Judy, please unmute yourself.
Sorry about that. Yeah, I'm just trying to understand why 3 years and not 4 then. Are there scenarios where in fact it would only be 3 years?
And Judy, would you like to address that question too?
Sorry?
Who would, oh, okay, Dan.
Oh,
I can take a stab
I see what
at
you meant. Okay, I'm sorry about that.
I can take a stab at it, Judy, and if I've misinterpreted, then you can correct me. I guess the scenario where it could be 3 years would be appointments by the dental schools. Those are not part of the election process, and so there could be a scenario where an individual comes in at any point in time. In fact, it happened when I first started. The Western representative was changed, and that was midstream of a calendar year and a council cycle. So if I've interpreted your question correctly, there is a scenario where it could happen in 3 years, not just 4 years.
In a scenario like as the one you just described, would that be why would there be a need for a cooling off period at all?
Well, the individual is subject to the same rules and may have had involvement in another organization like the Dental Association or another association where the mandates might conflict. So those rules apply to anyone coming in from the profession in terms of their engagement in the decision-making capacity with an organization.
Okay, I mean, it seems to me that in the vast majority of cases, it would effectively be 4 years. So I mean, I have no objection to 3 years, but I just wanted to understand why 3, not 4.
Thank you, Judy. Alan?
Yes. Well, I think you have to remember that this applies to 3 categories of individuals. Insofar as the elected councillors are concerned, the only time it wouldn't, from a practical purpose, be 4 years if you were filling a vacancy. There will be occasions where, in fact, an individual is unable to serve for the whole of the term, and then the 3 years would apply versus the practical effect of 4 years because of the election cycle. But probably more importantly, the same rules apply to the non-council members. non-council committee members. So that's where you're looking at the actual number of years and how long they should be away from any potential conflict before they can serve in a non-council committee role. And then there is, as the registrar indicated to you, the potential for the selected academic members who do change, not on an election cycle necessarily.
Thank
Okay,
you.
thank you.
Oh, Dan?
So I think Alan said it, but it assumes that the timing lines up that an individual leaves their portfolio, whatever organization, and wants to run in the council election and has to wait for 2 election cycles. But their departure from these organizations can occur anytime. There could be a council by-election. There are a number of scenarios, I think, where it's not 4 years. I think we're trying to land on a number that seems reasonable, seems consistent with other organizations, and in this case, you know, what one of the world experts on regulation has said, it's landing on that number. And then I do think that there are possibilities where somebody could run it won't take 4 years for them because of their circumstances and timing with the other organization.
Okay, thank you.
Next on my list is Gildo.
Thank you, Hannah. Dan, I want to ask you if you can clarify a little bit for me the example that you gave for the academics position, for example. I don't understand what you mean in terms of being working in different organizations. So, for example, working with a CFG would constitute a conflict for the Royal College?
No, Gildo, I think we have to look at the nature of the organization. The one that always comes to mind as the example would be the association that represents the profession. And the mandate is different than from the regulator that is there for the public interest. So you have to look at the organization and you have to look at the individual and did they have a critical role within that organization as part of the decision makers? So were they on the board? So it's not cut and dried. I think we have to look at each situation, but there are academic representatives that may be in those roles in organizations where the mandate does conflict with the college, and we have to look at that specifically.
Okay. Thank you.
Thank you. I have no further speakers, so I am going to call the question again. I'm going to ask for your indulgence to please physically raise your hand and leave it up until I've counted and asked you to lower your hand again. So all those in favor of that motion, please raise your hand now. Okay, so Angie, I got 23. Did you?
Yes, I have 23.
Okay, thank you. That motion is carried. Sandy, I'm turning it back over to you.
Thank you, Hannah. So the third proposed amendment pertains to public members. Our current bylaws do not clearly articulate which conflict of interest provisions apply to public members on council. So the executive committee was in agreement that we should have that these conflict of interest provisions should apply uniformly to both professional and public members to the extent possible, and that these expectations should be clearly set out in the bylaw. So a new bylaw for your consideration would essentially state that the conflict of interest provisions apply to all council and committee members. Again, this does not require circulation, and staff have proposed that bylaw 13 amendments go into force at 12:01 a.m. on June the 30th, 2022, to provide time for implementation. So Hannah, back over to you.
Thank you, Sandy. So for your consideration, motion number 2C is on the screen now, that council approves the proposed amendment to bylaw 13 to add a new article 13.1.01 under the heading General as set out in Appendix C, pertaining to the application of conflict of interest bylaw provisions to public members, such amendment to take effect at 12:01 a.m. on June 30th, 2022. And I am seeking a mover to that motion, please. Mark Trudell, seconded by Nancy DeSanto. And at this point in time, if there's a question, okay. David Bishop, I saw your hand go up, and Alan, I've got you on my list. So David Bishop, you first, please. David, please unmute.
The definition of conflict of interest by a public member, how do you, who determines that whether there's a conflict or not?
Dan, can I throw that over to you?
Sure. And then Alan, I know he's in the queue and may want to comment as well. The section that is being proposed where the change will occur, David, is the general conflict of interest section. So not eligibility related to organizations that you've worked on, but in the performance of your duties as a council member. And it's proposed that the language just be refined to add that section applies to public members as well. And then I think when you get into the business of actually declaring or individuals declaring conflicts or having questions about conflicts, it would follow a similar procedure that we have for anyone, that you can have a chat with the registrar, with me. You can have a discussion with the president. We could involve legal counsel if needed to really understand if it is a true conflict or not, and decide, does any member, professional or public, need to remove themselves from a discussion or a decision. So really the change is just to make sure that this section applies to all council members.
Okay, Dan, to the point, maybe just a process of how to evaluate whether or not you have a conflict, and that could apply to the professional members too, that the process, registrar, president of the association, that would be the course of evaluating a conflict. Maybe that needs to be defined somewhere.
Yeah, I'm going to defer to Alan because I'm not off the top of my head aware of where it's defined. I feel like I've seen it somewhere, but I will defer to Alan.
Alan?
So 2 points. To answer your question, David, the definition of what's a conflict and what you do via process is in the existing bylaws. So it depends whether you're sitting as a council member or you're sitting as a committee member, if you're sitting on a hearing or you're sitting on a decision-making process for a member. Each of those types of situations is set out in the bylaws, and it tells you exactly what you should do in those circumstances. So the process is in there. It just needs to be, your memory needs to be refreshed. Insofar as this amendment, however, the conflict of interest requirements have always applied to all council members. So I don't want you to think this is a change in the application of the conflict of interest provisions. It is a change in the sense that it is stating clearly in the opening article that it does apply to all council and council members and all non-council committee members. So it's very clear now, because I gather it from time to time people didn't know or understand or accept the fact that it applied to everyone, but it always has. So it's not change in the effect of your bylaw, but it is clarifying it for everyone concerned.
Thanks, Alan.
That's okay.
Cam? Yes. Thank you very much. Thanks, Alan. I agree with that. Can you tell me at any point during the history of the college when a public member is appointed by government that we have ever looked into conflict of interest? And do we have any power not to accept that person. My understanding is we do not.
So this is not a refusal to accept an appointment by the Lieutenant Governor and Council. In other words, this is not talking about whether the individual can serve on council. It's just applying the conflict of interest rules to everyone, so that if that individual has a conflict of interest, let's say, or a perception of bias in respect of a matter being discussed at council, they have to take the appropriate steps in the bylaw, which include not taking part in that discussion, absenting themselves from that portion of the meeting, and so on and so forth. So you are right, Cam, that we have, to my knowledge, we have never had a situation where we could refuse a council member appointed by government as a public member, as a member of council.
Right.
They are entitled to be a member of council, but the rules about what they can discuss and what decisions they can impact apply to them, just like they apply to all other councillors and non-council committee members.
And how, Alan, how do we determine if they do have a conflict of interest, if they do not declare it?
Well, I think that's something yet to be determined. I mean, it's the same way that I think the reason why the college is looking to have a declaration form is to transparently show everyone, including council members, where conflict of interest might exist, so that it can assist people in ensuring that they do not take part in matters where there could be a conflict, but they didn't recognize it or see it.
Yes.
But it would be the same for a dentist member of council today. What do we do if an individual doesn't declare the conflict, or we're not aware of the conflict? Well, there are there are some pretty significant consequences for that. The most significant would be for a public member that we would not allow them to take part in any council meetings further. They would still technically be a member of council, and that's never happened, and I hope it never will happen.
Yes.
But could it happen? I think it could.
Yeah, I think it could too. The problem is, the way I see it, and I'm maybe totally wrong, is what mechanism do we have to counteract this?
Well, there have been well, I shouldn't say that. I don't want to get into any details. There have been situations at many colleges where information comes to the attention of the college, I'll just say, which makes it concerning regarding the appointment of a public member, and that information may be relayed back to the appropriate ministry and ministry personnel, and the individual no longer is a public member of council.
Yeah.
But that's the ministry taking action. Okay?
Yeah. So
we also have in your bylaws the ability to take action in respect of anyone who acts well in a conflict of interest.
Okay. I guess my next question is, how do, like, the ministry is going to be appointing everyone now, and obviously will be for political reasons. Is there any mechanism we can find out if there is a conflict of interest from that?
Well, I think what's been proposed by staff in the proposed bylaw amendments is going to assist you, because every person, both public member and professional member of council and non-council committee members, will have to complete a conflict of interest declaration form, which will anticipate be available for all council members to see. So that's going to go a long way in assisting. You asked the question, well, if someone doesn't put it down, what can we do about it? Well, if nobody knows about it, I don't know what you can do about it. When you find out about it, there will be something to be done about it.
Okay, I understand. I suspect the government will know, but that's beside the point.
Thank you. Dan?
Yeah, Alan said most of what I was going to say in terms of you develop these procedures to have multiple points where people declare, self-report, or information can come to somebody's attention, and they're not foolproof. But if you create enough points of contact, then you're able to, in all likelihood, determine that somebody had a conflict and didn't declare, or you're able to gather that kind of information. It's a little bit like the challenge we have as a regulator.
Yes.
We may not always know what members are doing, but at some point it will get back to us. It will get to us in terms of information, because we have multiple ways to gather that information.
Yes.
And I just want to be clear with council too, and I know, Cam, that you likely didn't mean this, but we don't have those reforms yet from the government. And what we understand is that there would be a selection and nomination committee. And what we've heard is that the professional members would be part of the appointment through the colleges, not the government. So again, I just want to be clear on that point. We don't have it yet. And we know that the College of Teachers has a selection committee that is through their own council, not through the government. The LGIC appointments of public members would continue. Just to be clear with council in terms of where we are on the status of that.
Yeah, that would be great. Government does not have a great reputation in that area, but that's just my opinion.
Thanks for that information, Dan. I still have Mark and Judy on my speakers list, so I'm going to go first to Mark Trudell.
Thanks, Mano. So I just want to chime in and offer up that all members of the public appointed to public bodies are subject to conflict of interest rules. It's enshrined in regulation. The regulations, I think it's Reg 381. That regulation, in response to a question that arose by David earlier, David Bishop, what are the criteria? The criteria are laid out. It's very succinct. You, as a member of the public participating in this body, I reviewed it. You check off the boxes, and it's really a self-evaluation in that regard. So there's a clear set of rules. It's enshrined in a regulation. To my knowledge, it applies to public members appointed to public bodies. It's administered by the Commissioner of the Integrity Commissioner of the Province of Ontario. That is not to restrict this college and this council from raising the bar even further. That's a baseline set of requirements. Back to you, Mano.
Thank you, Mark. Last speaker on my list.
Great news, Mark.
Last speaker on my list is Judy.
Thank you. Yeah, I just wanted to say that, in the organizations that I've been involved with over the years, the conflict of interest declaration isn't just a no, I have no conflict signature. It's you're required to list any of the other of the types of organizations in which you might be involved. Let's say what your position is there, etc. And then typically the organization will evaluate whether that's a conflict for them. So I was assuming that that was what would happen in this case. But also, I was wondering whether you're contemplating having somebody with a potential conflict who recuses themselves from debates on certain issues. Do I need to say who? Alan, Dan?
Sure. That's already the situation.
Yeah.
So in the conflict of interest bylaw that follows under under Chapter 13, it tells you what you have to do depending upon the nature of the meeting or hearing that you're conducting or participating in. And yes, we have had many examples of individuals declaring a conflict, either at the beginning of the meeting or a beginning of an item. When we met in person, we had people leave the room, so they were not party to the discussion. And of course, they did not participate in any vote, and they didn't try to sway anyone else in voting in a particular manner in respect to that item because they have a declared conflict of interest. Sometimes it gets tricky. I mean, people say, well, I'm a dentist and this affects dentists. Is that a conflict of interest? Well, not of the type that you have to declare. Everyone knows the dentists on the council are dentists. But we have had situations where there's a specialty involved and only a specialty, and the one or two specialists on the council have determined that it's not appropriate for them to participate. And they have either requested some assistance from the registrar or other legal advisors of the college in terms of how to handle that prospective conflict of interest. The difference, I think, as you're saying, Judy, is it's anticipated there would be more to the conflict of interest declaration than, and Dan should speak to this, than I have no conflicts of interest. The idea is it's going to have details so everyone can help.
Right.
The word isn't police, but monitor the situation, ensure that no one gets into any difficulties with regard to conflicts.
Thank you. Dan, did you have anything else to add to that?
Very quickly, that's exactly the point, Judy, that we're working on what that declaration will look like now. And you'll hear more about it, and the executive committee will be helping us with the content of that. So stay tuned on that one. And you'll talk a little bit about that in the coming sections of this topic today.
Thank you. Cam, I'm not sure, did you put your hand up again?
Yeah, I just have one more comment. I've had considerable experience with the decisions that the provincial government has made, not through me, but through someone else who I won't mention. Conflict of interest virtually has no value whatsoever. That's been my experience over 20 years, and hopefully that has changed.
Thank you all for your questions. At this point in time, I am going to call the question. A reminder again, since this is a bylaw, I'm going to be looking for 2/3. So again, I would ask that you keep your hands elevated until I ask you to drop them. All those in favor of the motion, please raise your hands now. So Angie, I have 24. Do you as well?
Yes, I have 24.
Perfect. So that motion is carried. Thank you for that. And Sandy, I'm turning it back over to you.
Thank you, Hannah. So the fourth and final proposed bylaw amendment pertains to conflict of interest declaration forms. So currently, every professional council member must complete a declaration form regarding eligibility criteria and some potential conflicts. This is a one-time requirement. However, the CPMF requires that all council members complete a conflict of interest declaration form on an annual basis. The executive committee supported the idea of an annual declaration form. A new bylaw provision that reflects this requirement is before you today for your consideration and approval. And staff have proposed that bylaw 13 amendments go into force on June 30th, 2022 to provide time for implementation. Back over to you, Hannah.
Hannah, you're on mute.
Thank you for that. We're going to address the final motion, which is motion 2D, that council approves the proposed amendment to bylaw 13 to add a new chapter 13.4 under the heading Conflict of Interest Declaration, as set out in Appendix C, pertaining to the requirement that all council and committee members complete an annual Conflict of Interest Declaration form, which will take effect at 12:01 a.m. on June 30th, 2022. And I am going to be looking for a mover to that, Ram, and a seconder, Ellie Fisher. And I would now, I see Mark Trudell, you have your hand up. So Mark, you have first question. And Mark, you're muted.
I apologize, Mano. I was just moving to approve the motion. Or
I'm sorry. Okay, not a problem. Okay, I'm not seeing any raised hands, nothing in the chat. So at this point in time, I will call the question. And again, it is a bylaw. So please keep your hands elevated until I ask you to drop. So all in favor of this motion, please raise your hand now. So Angie, again, I have 24. Do you have that as well?
Yes, I see 24.
Thank you. So that motion is carried. And Sandy, I'm turning it back over to you.
So thank you, Hanno. One final bylaw amendment for information and discussion purposes only. There will be no decision on this matter. Concerns making these forms public. So not only does the CPMF require all council members complete an annual conflict of interest declaration form, but it also requires that council members' completed forms be included as an appendix to our meeting packages. And at the beginning of each council meeting, members declare any updates to their annual declaration form and whether they have any conflicts of interest based on the meeting agenda items. The executive supported the idea of making these forms public with certain caveats. Conflicts extend to family, and the definition of a related person is set out in bylaw. Once annual declaration forms are implemented, a council member would be required to disclose or declare any indirect conflicts. For example, a family member's conflicts. To give you an example, a council member would be required to declare a family member with a relationship to a corporate or virtual dental chain. Staff will give further consideration to the content of the declaration form, screening questions, what information could become public, and how to manage potentially confidential or sensitive information. Staff will provide the form to the executive committee and/or council, and council will be asked to consider and approve a new bylaw provision requiring that all council members' signed conflict of interest declaration forms be included in the council meeting materials and be made publicly available at the June council meeting. I will turn it back to Hanno to lead the discussion on this topic.
Thank you. And basically, for your consideration in terms of discussion, is council members' completed conflict of interest declaration forms will be included in the council meeting materials and made publicly available. Joseph.
So just for clarification, would this be like for every meeting, like it would be attached as an appendix? I don't know who I would be addressing that to. I guess perhaps Sandy or Dan.
Dan?
So the college performance measurement framework contemplates a meeting by meeting disclosure. Things can change. You have an annual declaration, and there would be a meeting disclosure as well. And we would have that information available in the materials. We're not doing this yet, Joseph. We are preparing. We have a lot to think about in terms of the content, in terms of the implementation. But I do know that there are some other colleges that I've scanned some of their council materials, and they have that kind of form in based on the materials that are available for that meeting. So it does go beyond the annual declaration, and it goes to a meeting by meeting release of those forms to the public as part of the materials.
And just a quick follow-up, has there been any thought of perhaps simply like posting it on our website or having it available on the website rather than as part of the actual package for each meeting?
Yeah, I think we're still talking about that. I don't know if we have the exact place where that would go yet, but we will look at some different options. And I think the point is making that information available to the public and accessible to the public.
Thank you, Joseph. Rod?
Just a question. Wouldn't that information be publicly available through the current freedom of information procedures that the government has in place?
Colleges do not fall under the Freedom of Information Act. The government would, so it may be applicable for public members, but colleges are not covered under that act.
Okay.
Thank you. So Sandy, I believe I'm turning it back over to you for next steps, please.
Thank you, Hannah. So just to recap, amendment to bylaws 7, 8, and 9 will go into force immediately. Staff will begin incorporating these amendments into forms for the coming election. Bylaw 13 amendments go into force at 12:01 a.m. on June 30th, 2022. An annual conflict of interest declaration form will be provided to the executive committee and/or council, and a new draft bylaw provision regarding publication of these forms will be presented to council in June 2022. Staff will continue to consider other means such as education for addressing other conflict of interest related matters, such as calling attention to other council or committee members' conflicts and consequences for failing to declare a conflict or complete a declaration form. So that concludes this section of the conflict of interest piece. I will turn it back to Hannah. Thank you.
Thank you. So next on our agenda is motion number 3. It has to do with the Professional Liability Program Committee, and this item is for council's decision. The materials for this item are in your package from pages 211 to 220. At this point in time, council is being asked whether it confirms the appointment of Dr. Gihan Ibrahim to the PLP committee. The executive committee has recommended this appointment, and council is essentially being asked whether it confirms the executive committee's appointment. This appointment is being made to fill a vacancy. One of the members of the PLP committee resigned on December 11th, 2021. Dr. Ibrahim will fill the remaining term, approximately 2 years. Before we turn to the motion, does anyone on council have any clarification questions on this item? And Rod, I see your hand is up. I'm not sure if it's up for this or if it was up for the last item.
That was the previous one.
Okay, that's great. So I have seen no questions. So if I could have the motion on the screen, please. Motion number 3, that council confirms the appointment of Dr. Gihan Ibrahim to the Professional Liability Program Committee. This is a basic motion, so we just need a simple majority. I am looking for a mover to this motion, please. Mark Trudell, a seconder, Christina Cordero. Any questions or clarification? Seeing none, all those in favor? Opposed? Abstentions? Motion is carried. Thank you. So we have one more item which we're going to hopefully cover before lunch break. It involves 3 motions. Our next item is an update on district elections. The information for this item will be found on pages 221 to 235 of your materials. This is an item for council's decision. Council is being asked to approve modest changes to the bylaws and the process based on feedback from the previous election cycle. We are going to hear in a moment from two college staff who are going to assist council with these materials. Dana Simon will take council through the briefing note in your council package. Angelo Avasilis will provide a short overview of the eligibility programs and goals, eligibility program goals and framework. And I'm going to turn it over to you, Dana, to begin, please.
Thank you, Hanno. I'm pleased to be before council today to explain some of the proposed changes to the elections bylaws for council's discussion and decision. As you know, in February, the Ministry of Health advised that it's considering a number of extensive governance reforms and legislative changes that will affect all regulated health colleges in Ontario. Included in the reforms is a proposal for appointed boards rather than elected councils. At this time, there is uncertainty about the exact nature of the reforms and the anticipated timelines. 2022 is an election year for the RCDSO, and we need to continue to prepare for our election. However, given the uncertainty, we decided to only bring forward the minimum modest amendments needed to improve process. As Hanno mentioned, I will make reference to the briefing note starting at page 221 of the e-binder. The note sets out 3 issues for council's decision. None of the changes proposed require circulation to stakeholders. If council agrees, they can be finalized today. After the issues for decision, there are some for discussion, and we'll go through those as well. The issues for decision, first, I would ask you to consider the composition of the Eligibility Review Committee, or the abbreviation ERC. As you recall, the ERC is tasked with determining if dentists who wish to serve on council meet the competencies which were passed by council in June 2020. This was a significant exercise for the 2020 election, where 34 candidates needed to be reviewed, discussed, and written decisions issued. To do so, the ERC met 5 times over a 3-week period, and those were half-day meetings. In addition, in limited circumstances set out in the bylaws, the ERC may also consider applications from potential candidates who do not meet certain eligibility criteria and are seeking to be deemed eligible. All of this work is time sensitive, as potential candidates need to know if they'll be eligible to stand in the election or not. Currently, Bylaw 4 sets out that the ERC is composed of at least 3 individuals selected by the Executive Committee from among the registrars, executive directors, and chief executive or operating officers of professions regulated in Ontario, or individuals who previously held one of those positions. This is a relatively small pool of experts, and given the volume during the last election cycle, the Executive Committee appointed 10 people to the ERC, and they met in panels of 3. In order to maximize both diverse perspectives and availability, council is asked to consider expanding the composition of who may serve on the ERC while still maintaining its external arm's length composition. There are many individuals with significant regulatory and governance expertise and valuable perspectives who have never been the registrar or CEO of a regulatory body in Ontario. For example, former public members of a health regulatory body and current or former senior staff leadership from regulatory bodies other than our own. Participation of external members will help ensure good governance principles are fully considered by the committee. A bylaw amendment is required to affect the change in composition. The actual appointments to the ERC will continue to be done by the Executive Committee through a selection process. I'm going to go on to the next issue, and then we'll do all of the motions together at the end. The second requirement is to add a change to the bylaw for prospective council members to include a copy of their curriculum vitae with their application to seek election. This was a recommendation of the ERC. While most applicants did submit their CV, some did not, and the committee asked staff to go back and obtain those. The ERC found that in order to assess competencies, a CV was a basic requirement. Currently in the bylaws, applicants for non-council committee members must submit a CV, but the same requirement is not set out in the bylaws for council members. The third amendment is strictly housekeeping. In reviewing the election bylaws, a non-substantive error was noted in bylaw 9, where an entire paragraph was unnecessarily duplicated. To correct this error, the recommendation is to simply strike out the duplicative paragraph E of Article 9.4.1, and there'll be no substantive change. Those are all of the housekeeping election matters for council's decision today. We'll do all of the recommendations and motions for these items at the end of the presentation. Also, as you saw in the briefing note, there are a few topics for council discussion today to provide feedback to staff to consider. There are 4 items in the briefing note. The 4 topics in short are: 1, the process of the ERC, the Eligibility Review Committee, including adding a short interview component. 2, the candidate eligibility course, about which my colleague Angelo will do a short presentation in a moment. 3, future recruitment for diversity. And 4, support for election candidates, specifically about communication with voters. After Angelo's presentation, Hannah will open the floor for discussion and present the 3 motions for decision items. I now turn it over to my colleague, Angelo Avasias. Thank you.
Thanks, Dana, and good morning, everyone. I'm going to quickly share my screen. So as Dana mentioned, I'm here today to speak to you about our council and committee member eligibility course and some changes we're making to both the content of that course and the platform on which it's housed. So quick agenda of what I'll cover really briefly. The course framework and topics. So we'll get into things like the organization's mandate, the election and appointment process, the issues of equity, diversity, and inclusion, and the importance of transparency and the accountability to the public. And also content about our strategic plan and the college performance measurement framework. At the end of my presentation, I do have a couple of questions for discussion, and I'll run through the process for that when we get there. So why does the college have an eligibility course? So there's 2 main reasons. The first is just to ensure that professional candidates for council and committees have a good understanding of the college and the role they would play within the organization. The second reason is to provide the public with the ability to understand the mandate and activities of the college. Obviously, we have a very robust website with a lot of content, but this course does provide a really focused opportunity for members of the public to gain insight and knowledge about the organization. So the objectives of refreshing the current course content. We're going to use relevant content from the existing course. That course was launched in 2018, so it's been through 2 election cycles. It's due for a refresh, but there is still relevant content there that we'll use as part of the redesigned course. We want to be able to describe how the college fits into the larger Ontario health regulatory landscape. And we're going to focus on emerging trends in regulation and the strategic project work happening both at the staff level and at the council level. And as I mentioned, we're going to develop the course on a new platform. So the current course, again, is housed on our website, and we're transitioning the course to a learning management system. And in a couple of slides, I'll speak to why that's important and how that gives us a bit more flexibility when it comes to creating some engaging content for users. So we'll dive right into the course framework and topics. So these are basically blueprints for the course, very high level topic areas. And once we flesh those out, we'll develop content specific to each area for the course. So the first section we envision for the course is really talking about what the college is and who we serve. So there'll be a brief introduction to the course. The course will be about 35 to 40 minutes in length. And there'll be a table of contents covering the topics that will be covered as part of the course. We'll get into the college's mission and values, our public protection mandate,
We'll talk about the differences between the regulator and the professional association, and we'll also draw attention to the accountability of council to the public and to the Ministry of Health. And then we'll dive into an overview of council and committees. So we'll talk about eligibility requirements, competencies for council and non-council committee members. We'll address distinctions between statutory committees and standing committees, and also distinctions between the role of a council member, a committee member, the registrar, and college staff. And then we'll talk more about the roles and responsibilities of council and committee members. And we'll focus on issues such as preparedness and professional learning and ongoing development. We'll talk about the importance of making informed, evidence-based decisions, adhering to confidentiality and ethical decision-making. There will be a new focus on equity, diversity, and inclusion, and on consensus building. You've seen that become a theme, both in your own orientation last year, and also in discussions we've been having from a strategic planning perspective. And we'll also talk about what Sandy Varechia talked about this morning, the council evaluation process, and how that'll work and inform the work of the council. And lastly, as part of the course, there will be a short review area, a section, and a link off to resources if folks want to find out more information about the organization or specific topics. So we see the review being comprised of 10 to 15 questions that cover the course material. And again, there'll be links to relevant information, so election information, links to relevant bylaws, and to documents such as our strategic plan, the CPMF, any resources that inform the learning opportunities for the users taking it. And this is a review. It's not meant to be a test or an assessment. It's really meant to reinforce the key messages and content that form part of the course. And I talked earlier about switching over from our website in terms of housing the course and really porting that over to what's called a learning management system. So that allows us to do a lot of creative things and create more engaging and interactive content. So we can create scenario-based activities about equity, diversity, and inclusion and consensus building. For some of you that might have taken some professional development courses online, it's really about creating an objective, taking people through a specific scenario, and at the end of it, providing them with some options as to what actions they could take. And we find in the adult learning environment, that's a really good way for people to retain knowledge. We'll make really good use of video and infographics. Again, attention spans being what they are these days, we think video and infographics really have the ability to get into content, dive into it really quickly, and provide end users with a really good opportunity to engage with content, but in a really shortened time frame. And there'll be other activities, again, to reinforce the learning. With the platform we're moving to, we're able to do a number of things, a number of exercises, things like flip cards, matching activities to kind of make connections between various content. And I guess the point of this really is that, moving to this new platform just gives us a lot of opportunities to create a better content and to engage our end users in a different way. So I mentioned off the top that we are looking for your input. Obviously, that's critical. Having been through the process yourselves, I'm sure you have a lot of valuable insight to pass our way. So I have 3 questions here on the screen. I know we're a little short on time, so we'll try to get to a couple of comments today as part of the meeting. But after the meeting, you will be receiving these as part of a short survey. So if we don't get to you today, not to worry, that survey will go out and you'll be able to provide more focused feedback as part of that survey. I'll also ensure that you guys receive a copy of this deck to give you a bit of a reminder as to the topics that'll be covered as part of the course. So the 3 questions that we want to put in front of you, are we on the right track? Do you see any gaps? In hindsight, is there something you wish you would have known about council or committees before you joined the organization? And lastly, I kind of like this one. Is there one key message about your role that you would tell to a council or committee applicant based on your experience, based on the work that you've done as part of council to date? Is there that one key message that you would want to convey to a prospective council or committee member? And with that, I will stop sharing my screen. And again, I know we're a bit short on time, but if people do want to provide some immediate feedback, I'm happy to take a couple of comments.
I don't see any hands raised and nothing in the chat. So again, we'll follow up with that survey where you can provide your feedback there. And again, we'll share the slide deck so you have a good overview of the course content and topics. With that, Hannah, I'll pass things over to you.
Thanks, Angelo. I have to say, as someone who has had 16 years experience sitting on councils and committees, I find this a really exciting venue that you're traveling down, and I think it'll be very productive in terms of what you're hoping to get. So at this point in time, I do want to thank both Dana and Angelo. We have 3 motions for your consideration. And I will give again just one more shout out. If you have any questions of either Dana or Angelo or questions of clarification, I'm going to briefly scan to see if anyone does. I see nothing. So if I could ask to have the first motion put on the screen, please. This is motion 4A, that council approves the following amendment to bylaw 4 to broaden and diversify the composition of the eligibility review committee, set out as follows at Appendix A 4.17.1. The eligibility review committee shall be composed of at least 3 individuals selected by the executive committee from among persons with significant expertise relating to professional regulation and governance, other than current or former employees of the college, current members of council, and current or former members of the college. So that is the motion in front of us. I will be looking for a mover, please, and a seconder. So Brian Smith is the mover, Judy is the seconder. I would remind you, since this is a bylaw amendment, we are again going to be looking for a 2/3 majority. So again, I will ask for your indulgence and to keep your hand raised until I ask you to lower it. So all those in favor, please raise your hand now. Okay, Angie, I have 24. Do you as well?
Yes, I have 24.
Thank you. So that motion is carried. Our next motion for your consideration is motion number 4B. That council approves the following amendment to bylaw number 7 and bylaw number 8 to require dentists who wish to serve on council to provide a copy of their curriculum vitae with their application as set out at Appendix B. So again, I'm looking for a mover and a seconder, moved by Peter, seconded by Mark Eckler. Again, a reminder, this is a bylaw amendment, so we need a 2/3 majority. So all those in favor, please raise your hand and keep it raised until I tell you to. 1, 2, 3, 4, 5, 6, 7. So I got 23 this time, Angie. Did you get 23 or 24?
I saw 24.
Okay, so thank you for that. That motion is carried. And the last motion for us to consider is motion 4C, that council approves the housekeeping amendment to bylaw number 9 as set out at Appendix C. So again, I'm going to be looking for a mover and a seconder, moved by Brian Smith, seconded by Jamie. All those in favor, please raise your hand. And again, I had 24. Is that what you had, Angie?
I have 24.
Thank you. So that motion is also carried. So at this point in time, I think we have accomplished a significant amount of work this morning. It is time for us to take a break. I'm going to recommend we are right back on time. We will do a 50-minute break. So we will reconvene for our afternoon session to begin at 1 o'clock. A reminder as well to council members to please mute yourself and turn off your video, and to be back in place ready to begin our afternoon session at 1 o'clock. For those of you watching today's meeting on YouTube, we will be stopping the live stream for lunch now, but will resume shortly before 1 p.m. So thank you, enjoy your lunch, and we will see you here at 1 o'clock. Welcome back. We are aware that for some of you, even though it was a 15-minute break, it may not have been enough time to do some of the things you needed to do as well as have your lunch. So if you're in a position now where you are still finishing your lunch, I would just ask that until you finished eating, you just turn your video off. But welcome back. Next up on the agenda is the RCDSO's strategic plan. The materials for that part of the agenda are on pages 236 to 247 of your meeting package. Council is not required to make a decision. This is an item for information and discussion. We're going to spend the majority of our time discussing issues related to the development of the RCDSO's next strategic plan. Dan and Andrea are going to be taking council through some information. Council will then be broken into smaller groups and to discuss the questions set out in the briefing note, and we will use the same small groups that we used and had established this morning. So having said that, I'm going to turn it over to Dan right now. So Dan, it's all yours.
Thank you, Hanno, and welcome back, Council. I'm just going to say a few words. I want to make sure that there's lots of time for Council input, but I want to say, just to start the session, that this is a very exciting time. And I guess it depends on your perspective, but I happen to believe in the value of strategic planning, and I think it's finding that sweet spot of not spending a long time overanalyzing or trying to come up with the perfect plan, but enough time that appropriate input is received from stakeholders, and also for council, council being obviously a very key stakeholder. So I mentioned this morning that we have a strategic plan. It's not a new concept, and that we've had one for the last 3 years at RCDSO, and it's quite aspirational. There were many priorities and there was a lot of work, but we did what we could to advance it, and I believe that we advanced it quite a bit. What I want to do is just give you what I think are a couple of tips in terms of moving forward and really trying to lay the groundwork, because strategic planning is really about advancing the organization in some key areas. So the first message that I would want to say is always think about how we are going to become and be laser focused. We cannot do everything. I obviously showed you some of my reflections this morning on the work that we must do planning, and sometimes the work that we have to do because it comes in the door on a moment's notice. So our plan has to be laser focused. We have to really confine ourselves to a small number of big goals, because if we don't focus, we'll risk doing very little. The second message is really asking for your patience and really your respect for the process. We all want to jump ahead. I'm impatient about some of these things. We have a great opportunity here to hear from stakeholders and to use the information about the environment and to work with you and work with the executive committee in an iterative fashion to get to a point in September where we have the best plan that we can come up with. So I want to really ask for your indulgence in doing this work iteratively. And the third point is really about compromise, because all of us will have our own goals. We'll have our own perspective on what this college needs to do, where we need to go, how we need to get there. And a great strategic plan is going to hear broadly from a lot of people, and then we're going to hone in on those most important things. Articulation of how we move forward, how we define success. And so I think at this point, rather than having 7 priorities as we did in the current plan, we're really trying to challenge ourselves to come up with 2 or 3 very big focused goals. So that's obviously not going to capture every idea that all of you have, but it's really going to assess how we move forward as an organization and put our resources and time to the things that are going to create the highest yield for RCDSO. And then finally, in terms of just the mechanics of a plan, for those targeted or focused goals, we are going to try with you as we move towards to September to really define as definitively as we can what success looks like, and develop a multi-year plan around that, including milestones, including resource needs and resource commitments. And that's going to be taking our strategic plan to the next level. But a lot of great work has happened at RCDSO. This council was very visionary in terms of the elements that you put into the current plan. And I really am energized by strategic planning, and I hope you are too. And I'll turn it over to Andrea now, because today is the first meeting with council to really start to pull together a lot of information that we have. Andrea?
Great, thank you, Dan. And I'm just sharing my screen here. Someone could just give me a thumbs up if you can see those slides. Okay, thank you so much. So, yeah, thanks for those comments, Dan. What I'm going to do today, we've got roughly an hour together on this item, Council. And so what I'm going to do is I have a short slide deck. I'm going to take you through some context and background, and especially information about our process to date. And then I'm going to talk you through a little bit about how we're going to use the breakout sessions. I'm going to try to move as quickly as I can through my parts, because we want to spend the bulk of our time allowing you to have discussion and engagement. So here's what we're going to focus on in this deck. Although the briefing note in the package gave you some information about the sort of the last year, 2022, for our current strategic plan, this session we're going to focus on the development of the new one. So I'm going to talk to you a little bit about the development process, how we've been proceeding to date, give you a high-level summary of the feedback we've received, and then we're going to focus on you and your thoughts. That's really going to be the emphasis today. Okay, so you would have seen in the briefing note, our development process to date has really focused on consultation and engagement. We wanted to go out at a very early stage to get some initial feedback from a variety of stakeholders, as Dan said. So that has included two different tactics. We've developed a couple of surveys. You, as council members, participated in the external survey, which also was open to the public, to all dentist members of this college, and to a range of stakeholder organizations. We also prepared a survey specifically for RCDSO staff. They were a really important stakeholder in our current strategic plan and developing that, so we wanted to hear from them. Then we had a couple of really focused discussion sessions. First, with our executive committee, where we asked them at their January meeting some questions. We did the same with RCDSO leadership, so our managers and directors. And then today we're going to do the same with you. And the goal here is to get some early feedback that will help shape the direction we go in as we start to prepare and actually write a draft strategic plan, which you'll then be able to give us feedback on. I'm going to cover a little bit of information about the feedback that we received. I do want to say at the outset, my summary here is going to be very high level. And I think I covered this in the briefing note. We had you'll see here, a very significant rate of response, particularly to our external survey, with a total of just over 1,500 surveys completed. Because of that, and when they closed, they just closed February 18th, and the deadline for submitting our council materials was a couple days after. We just didn't have enough time to give you a really robust report. What we are going to do is today I'll cover a bit more detail than what was in the briefing note. At your June meeting, we'll provide you with a more complete report. Oh, sorry. So let me just go back. So internally to our staff survey, we got a response rate from responses from 56 members of staff, which, I think is a pretty good rate of response. The first quarter of this year has been a challenging one with COVID and a bunch of other things. So I'm pleased with that. Really, the showstopper here is the rate of response we got to the external survey. just by comparison, I've done a fair amount of stakeholder engagement and consultation in my career to date, and I would never have predicted we'd get this rate of response. This is really, really exciting. Generally, not everyone is excited by strategic planning as you may be, and as Dan is, and I am. And especially at a really early stage of a process, you tend not to get as much feedback. So really, really pleased that we heard from so many individuals. The last row here just gives you a sense of, did individuals complete the entire survey, or did they sort of drop off at certain points? Just to normalize that, those of you who've had experience with surveys, it's pretty common for participants not to complete the entire survey. So it's nothing that I'm concerned about. We just wanted to include that there so that you were aware. Who did we hear from? Well, the real story here is that we heard significantly from members of the profession. So they comprised 96% of the respondents that we heard from. We heard a little bit from members of the public, from stakeholder organizations, I think about 5 or 6 organizations in total. And then we had a couple other categories, healthcare professional, and then some people preferred not to say. This was, if you remember from the survey, this was a question early in the survey where we asked participants to self-identify. So this is where we're getting that from. What did we hear? Again, these are sort of really high-level snapshots of what we heard, but we asked a question about, our current strategic plan and those 7 strategic objectives included, which were, we asked participants, which ones should we continue to prioritize? And these were the top 3. Decision-making, continue to be informed by best available evidence and data, college governance, and then a focus on continuous quality improvement and risk-based regulation. We asked also, for advice and thoughts about what participants felt were the key issues facing dental regulation. The type is a little bit small, but I hope that on your screens, you're fine to read it. I'll just go through it briefly in case you can't. From green to pink, the green is professionalism, COVID-19 impact on dentistry, access to oral healthcare in yellow, corporate dentistry, direct-to-consumer initiatives, teledentistry and virtual care, and then lastly, artificial intelligence. So really interesting list. And you can see many of those issues are pretty close in numbers in terms of what people are sort of thinking are the top issues. We asked a broader question as well. Is there anything else participants wanted to share with us as we moved ahead? And sometimes this is a good tactic to use just because, it's good to ask some focused questions, but it's also good to give people space to just tell us additional things. We had a lot of feedback on this. So again, this is really sort of high level summary, but what we heard broke down into these 3 categories. So system collaboration, one of the comments that we heard was, really important to have unified and common guidelines. So a lot of people talking about, RCDSO's engagement with other oral healthcare colleges as well as system partners. I'm going to engagement with the profession. I'm actually going to come back to in a moment because I have a few other points. I'm going to skip ahead. Dental practice and sustainability. Just a number of comments there acknowledging the challenges facing dentists, being sort of owner operators and the things that they have to grapple with. Turning to engagement with the profession, this is, a theme of ours today, and we've talked about it, but here's some of the ideas that we heard. Clarity about the RCDSO's role, having simplified guidelines and standards, increased communication between the college and dentists. And, one of the thoughts that came out of this is, a dialogue, a venue to have dialogue, whether virtual or otherwise. And I know some of this work we've started, we've done an event, RCDSO Connects. I know there's more of those planned, but just interesting to see that there's a real appetite for that. So in terms of, that gives you, again, a very high level snapshot. We will be coming back to you with more detail in June. In terms of today, what we wanted to do in terms of engaging you is we're going to have breakout sessions, as Hanno said. And we're going to use polling. We're going to put a polling question to you as well. What it will look like is we're going to, as Hannah mentioned, we're going to use the same groups you were in this morning for the council performance evaluation discussion. We have 2 questions we want you to grapple with. I'm going to put them on screen in a second, but the way we're going to structure it is we're going to break up the questions. So we're going to have you go off and think about the first question. We're going to come back as a larger group and do a sort of a rapid fire report back. We're then going to go back out to the breakout session for question number 2, come back again to report. We're going to ask those individuals that were spokespeople this morning, if we could call on you again to do the rapid report back, that would be great. I am going to have policy staff from the RCDSO attend at each of these meetings to take notes. Because we want to make sure that we're managing our time well, we're going to ask you to provide really high-level summaries of what your groups have talked about. The spokespeople, we're going to ask to do that, but we're going to make sure that we are able to collect all of your thoughts and get some really good notes so that we can go through those in detail. And just to, you may have seen these names on different briefing notes, but we've got Cameron Thompson, our senior policy analyst, Deanna Soifer, our junior analyst, Jean Hopkins, our policy analyst, and Kathleen Schiegel provides us with a whole host of support in a number of areas. So you'll see those names in your groups as well. So in a minute, I'm going to turn it back to Hanno, but I'll just leave this up here. The very first question we're going to ask you to deal with is the following. What are 2 or 3 issues or objectives you think the RCDSO should achieve in its next strategic plan? So this is about visioning. This is about proactive, ideas, issues. So Hanno, I'm going to pause and I'm going to turn it back to you.
Thank you, Andrea. So just to reiterate what Andrea said, we are going to be using the same 4 groups that we did this morning, the same spokespeople. And just remember that even if all of your comments are not shared when we reconvene, that notes are taking. So anything that was discussed or that is to be brought forward will come forward either through your comments or through the notes that the note takers have taken. The breakout session is going to be about 10 minutes. Once you're in your sessions, we will monitor it. You will be brought back in then to this setting after the 10 minutes. And as Andrea said, it is going to be rapid fire. We're giving you about 1.5 to 2 minutes per group to just, very quickly share with us the comments that you made. So the formal meeting will again be suspended during the breakout sessions. This will allow for the smaller group discussions. But again, to the public and to the council members who are in this group, to the YouTube audience rather, the people who are staying in the main room or the main meeting room, and there will be one group doing that. They will continue on with their work, but those of us who are sort of zooming in from outside of the council will be able to observe that. So again, we will leave it to the tech wizards who will momentarily send us to your breakout rooms. And once that happens, we will start a 10-minute timer. And then you will get a 2-minute warning again when you sort of have to very quickly wrap things up, and we will reconvene in this space in a little over 10 minutes. Thank you.
Are we good?
I think we're great.
We're missing Rod.
Okay. Oh, I see him.
Remember this morning, I think Rod, although I see.
It wasn't Rod.
Okay.
I see Rod on, at least on my screen. I just don't see his camera on.
Andrea,
Yeah.
he did send me a message before lunch saying he may be a few minutes late back, so to
Okay.
continue without him.
Okay, no problem. That's great.
Kathleen,
right.
I don't think we ever had the opportunity to have meetings. Nice to see you.
Yeah. Maybe Kathleen, if you want to introduce yourself to everyone.
Hi, I am Andrea's executive assistant. I've been at the college since November, and I'm really enjoying my time here, and I support the policy team in the office of the registrar. Nice to meet you all.
Excellent. You've got a great person to work with.
Yes, I do.
So why don't we start? And Kathleen, if we're going too fast or there's something you need clarification on, just jump in and stop us. I'll just reread the question, and maybe we'll follow the same format as this morning, but we will go in reverse alphabetical order.
Oh, too bad, Amelia.
Oh, darn.
Darn.
I'm just curious. Are we live on this?
Yes, we are live.
Okay, lucky us.
Sure.
Yeah.
Well, so better not say anything.
So everyone gets a minute to give a top of mind thought, and then we'll have 10 minutes of discussion. So the question, what are the 2 to 3 issues or objectives that the RCDS should achieve in the next strategic plan? So 2 to 3 issues or objectives. So why don't we start? We would have started with Rod, but he's not here. So Jack.
Okay, I guess I'm the W, am I? Well,
Yeah.
I guess really and truly, we started, I think, with 7 originally. And I think the most important, like we got to be basic. And the most important is service to our members, the registrants. And we talked about it earlier. Dan did about with the survey, how, calls are being dropped and the service isn't as good. And even the issuance of certificates, specialized certificates took forever. So that's the first thing we have to improve. That is that's a core item. So if we pick 2 or 3 things, that has to be one. The whole process of complaints, public interest, public harm, in other words, the ICRC and the disciplines committee, if we still handle that, especially being on the chair, doing things. Now I know 2017 and to 2019 is more or less finished. We've gone through it all, but it's still very sad when you look at cases that should take 150 days to resolve, take years. And it's not good for the public, and it's definitely not good for the member. So those 2 things in particular. And the last, to me, I've got this access to care, that I'm holding the torch to. I'm a flag waver. I think it's so important every day, even in the ICRC, we see people complaining because they can't get access to care. And it's a shame that in a rich province such as ours, there are people who are literally dying because of bad teeth and gums, and they're just not getting the care they deserve as a human being. So those are my 3.
Okay. Thank you, Jack. Brian.
There we go. I'm looking back at some of the points Dan made in his report to us at the time, and it rather ties in, I think, a bit with what we're trying to identify here. First, the importance of communication cannot be overstated, whether that's to the public, to the membership. And I really appreciate and would encourage further the RCDSO Connect meeting. I see was one held in November, and certainly there's another one being planned. I think that's key to keeping people informed and feeling that they're really informed, and having, perhaps more importantly, an opportunity to share their comments and views on issues of the day with us. The ongoing public interest in protecting that is certainly should be paramount to in everything we do. And I think we strive to do that. And we have to look to build our capacity to provide excellence and service to all the stakeholders. So they're rather general and broader tones, but I think if we're working within those parameters, we'll be doing some good things as we go forward.
Okay.
Thank you.
Thank you, Brian. Ben.
Thank you, Alan. So I think part of the strategic plan should focus on best practices. So when we're making decisions, and I think it encompasses a couple things. I think of course, we should be evidence-based, we should be data-driven, and we should have the decision makers be competent. So if you're covering these bases, then I believe that should be a best practice. I agree with we have to keep up with engagement, no matter what the selection criteria for council members becomes. We have to engage with the public, we have to engage with dentists, we have to engage with government. And that also includes service, and that also includes collaboration. So I think that's the second issue. And the third issue is I agree with Jack that we should be placing emphasis on access to care. Thank you.
Okay, thank you, Ben. And Amelia.
Okay. Some of it's repetitive, but I'm with Jack and a few other people that mentioned about the complaints. I just think there's got to be a better and more efficient avenue to resolve these complaints that are not resolved on a timely basis. It's not only for the public interest, but also for dentists together. And that needs to be fixed. And we've discussed it. I've discussed it with Erwin and other members for many years, and it just seems that it hasn't changed over the last number of years. At the same time, ensuring better service for our members. I always get calls from people I know and said, hey, I emailed RCDSO, I haven't heard from them. 2 weeks later. Okay, so, or a couple weeks later, and that's typically what seems to be happening. So that's my thoughts.
Thank you. I'll just put in my 2 cents on here. Just want to restate something Andrea said in the last slide: simplified guidelines and standards. That's of importance. And I'll just give you a little anecdote. We have people in the dental industry who are consultants who will come to your office and go through RCDSO guidelines for infection control and make sure you're up to date. And it's this new cottage industry that's spawned after the last IPAC guidelines. So this, I think, hits right to this point in that, dentists are educated people. They should be able to do this by themselves. The fact that there's a new cottage industry that sprung up tells you we don't have simplified guidelines and standards. It's hard to follow. So somebody's willing to farm it out to someone else and pay them. So I think if that industry ever disappeared, then it would tell me that we're on our way to having simplified guidelines and standards, which in the end helps everyone. Okay, thanks. So discussion about any of those points?
I'm with you 100% about the IPAC. It's just very complicated. It's not easy.
No, it's not easy.
Onerous, and I have a large practice, and there's no way I could follow it. I just don't have the time and energy. Even
And
my
I guess it all
staff,
comes
people,
down.
so we hire people.
And I guess it all comes down to communication. How we communicate with our members, because they should know. There should be easy access to the information they require, and the information they require should be simple and understandable.
Yeah, I think so. And dentists, just by nature, are rule followers. If you put in a crown and it's like 1/4 millimeter out, you don't sleep at night. Like we just want to. It's like we have a set of rules, we follow them to a T. We get upset if we don't follow them. So clear and specific guidelines are not something people will ignore, but you just have to give them rules to follow. Mm-hmm. So I agree with both of you there.
Mm-hmm.
Sorry, Brian, did you want to say something?
No, I just totally agree with what you said. No.
See, corporations were one of the things on the list.
Yes.
That's something we should be thinking about. Do you feel that corporations should be a topic as one of those 3 services? I guess what I'm saying is, do you feel threatened by corporations and long-term effects it has on dentistry?
Yeah, I've heard both sides of that coin personally. One, how could it be that we're having large corporations take over dentistry? It's not good for the dentist, not good for the patient. But the other side of that coin is they do provide a service. There's a lot of new graduates who they're employing who may not have wanted to start a practice on their own or may not have found a job otherwise. It gives them an opportunity. And I'm sure large corporations, just because of scale, in terms of reducing costs, which is an access to care issue, because once you reduce costs, it opens up care to some people at the bottom, because as you know, many dentists opt out of certain government programs. If anybody's going to figure that out, of how to control costs of the office, I would bet it would be them. Right? So good and bad. That's what I've heard.
What's your thoughts, Amelia? Because I know it's a strong issue for you.
Wow. Let's see. Should I start?
Sorry.
Front camera, right live.
I'm sorry
I think
to
there's
interrupt everyone.
pluses and minuses. I mean, there's a plus. I mean, I have lots of colleagues and friends that have gone to the corp, and most are happy. Some are happy, some are unhappy. I mean, you have to admit it's about money. They give an excellent remuneration for practices that can't be given by a private. So that's another thing. And then I hear, there's a bad side, but I really shouldn't get into it on camera. There's good and bad with everyone.
Fair enough.
Okay, I think we're all starting to reconvene in this room now.
And our rooms are closing in about 10 seconds, so folks should be back shortly.
Thanks, Angelo. I'll wait until you give me the go ahead.
We're seeing people come in now. Thank you.
Yeah, Hannah, I think we can get started again.
Thank you very much. Thank you all. We're resuming again in the main room so that representatives from each group can share some of the reflections on the first discussion question. Now, remember, Andrea made reference to rapid fire, and that's all it's going to be because, we just want to get a sense of where you are. So really, I'm going to time groups to 1.5 minutes. So rest assured, though, that even if you can't get everything that you want to say across to the group, you have had a note taker in your group. That information will all move forward. So at this point in time, I would like to ask a spokesperson for the first group, which I believe is the group that was in the main room. So probably Nalan, I'm going to pick on you again to start, but I would ask that you go first, please. And you've got 1.5 minutes.
Okay, thank you, Hannah. So just to summarize, I think what our group came up with was two main issues. One was governance and the other was communication. And under governance, to make sure like policies are data-driven, best practices are put into place, and good sound rules, regulations, and the way the RCDSO is governed, that was important. The second sort of sub-area was communication. And in this, it meant communication to the public, to our members, and to government, which also encompasses the whole concept of service to the members, service to the public. So some things that came up under that is, of course, phone calls to the college, questions about rules, regulations, governance, guidelines, and also the whole area of IPAC, sorry, not IPAC, but for complaints, if we can somehow shorten the time, that of course is providing good service and of course fits under the good communications role. So to summarize, basically two things: good governance, good communication. That's what we came up with. Thank you.
Great. Thank you so much. I would like to now invite the spokesperson from the second group.
Okay, thank you. So our number one issue that we feel should be addressed is professionalism and its overlap with corporate dentistry. We felt that the public perception of dentistry has diminished, so that business is first and the patient is second. We felt that the profession needs to get back to collaborative healthcare professions with not just dentistry, and that the business of dentistry needs to be secondary. And that really starts with the selection of candidates at the dental school level. We further feel that the standards of practice that are developed should be enforced for the protection of the public and not the profession, for improved quality health care, so that the public can depend on dentists that put healthcare first and everything else should follow. So that was number one. Number two, EDI, education for not only college staff, but council members and dentists at large. We felt that many complaints are due to a lack of understanding. Our third issue was governance reforms. We really enjoyed the conflict of interest declaration being a new component. We like that. And the fact that governance is changing quickly, we need to make sure that oversight function and responsibility of the RCDS is maintained. And lastly, we had a fourth, access to oral health care, more than just consultation, we need just more action as well. That's it.
Great, thank you so much. Now I would ask the spokesperson from the third group to please present your information.
Might be our group.
Sure, Joseph.
So there was a lot of emphasis in our group on education, being more proactive in our regulatory function, identifying areas of concern that may arise. For instance, like if there are frequent issues arising in ICRC or in other committees, how can we triage those and synthesize those and actually have a more holistic change within the profession writ large? Is there an education component to that? So that was a key takeaway. Understanding that access to care, there are multiple different ways or levels to really look at access to care. So defining that and looking at that more elaborately as well. Investing in the training of council members and more enhanced training of council members. There was also an interest in equity, diversion, and inclusion, more emphasis in that going forward. Acknowledging the developments that have been made by council, but the need to go further into that track and really encourage to have a more inclusive college, both with respect to council as well as outside of council, with the profession writ large. Those are some of the highbrow points that we discussed.
Okay, thank you very much, Joseph. And I would now ask the spokesperson from the last group to share some of the information from your group, please.
Sure. So we had a few things that we spoke about. We started off by discussing language and access or availability to assist the patients and public with regards to the Bilingual Act and other translational services, and basically acknowledge diversity from that standpoint. Also, any reform from a governance standpoint, there were discussions around making sure that they were in line or in sync or in the same direction as those with regards to the Ministry of Health. With regards to external disruptors, the creation of some sort of best practice guidelines to anticipate for any external disruptors and how to manage those type of situations going forward. And then finally, public awareness in terms of more along the line of awareness to the public and explaining to the public what the RCDSO does and being more of a resource directly to the public.
Great. So thank you so much for that. We are going to repeat exactly the same process in a moment. Andrea is going to put the second question up. We will then go into the breakout groups. The group that was in the main room will stay. The rest of you will go into your breakout groups. You will have 10 minutes to discuss. And when you get back, we will repeat this process as well. So Andrea, I'm going to turn it over to you just to highlight what the second question is, and then you can send them to the breakout rooms.
Yes, thank you very much. Okay, this is the second question. So some of you, it sounds like you touched on disruptors already, but wanting your feedback on what you think are the top 2 external disruptors that the RCDSO should focus on. There's a lot that's come at us this year. We expect that's going to continue, but just getting you to help us anticipate that in areas you think we should be really focusing on. So with that, I'm going to stop sharing, and you guys will then be sent off to your group. So look forward to hearing what you come up with.
Hey,
together again.
Welcome back, everyone.
And
Rod, welcome back too. We
Yeah,
have to make
my apologies. I had to take a break there, so for a family reason.
Okay, welcome back.
No worries. So the question now at hand is, what are the top 2 external disruptors that the RCDS should focus on? So top 2 external disruptors. So why don't we, do you want to start at the top of the alphabet?
Start in the middle of the alphabet.
We're in the middle.
Think about it.
Start in the middle.
So Amelia says yes, so go ahead.
I have to think about it. It gives me a bit of time to kind of warm up on this.
All right.
Okay, well
Yeah, you
then,
can go first.
actually, Rod, do you want to start?
I think I'm going to try and get back up to speed here. I'm just coming back in. Is this on page 236 of the material? 237?
241-ish.
241-ish. Why don't you guys start, and I'll do a speed catch up here, and I'll cut in later.
Okay.
Let me start off with a thought or two.
Sure.
External, I think government is probably the biggest one, and we've seen this time and time again. It's just a question of what is government going to do, and usually they do it because of political points, the voting, on and on and on. And we know the reforms, whether that happens or not, it probably will happen. We just don't know the form. But I think the next wave is going to be, again, access to care. We see that with senior dental care. They came out with, correct me if I'm wrong, it was $5 million or something overall, and that was it. And they limit it. And they can do that, the same thing with all dental care. Those who are underprivileged, or at least disadvantaged, they can do it with the whole population and everything in between. And I think we're going to see a government type of dental care program within Ontario. And that's going to change the way we do dentistry in Ontario. Sort of like OHIP has changed the way doctors are practiced in Ontario. I don't know if it'll be as extensive as OHIP, but I really feel the government must act because we're not doing it. Dentistry is not taking care of the people getting harmed. There's a lot of harm in for patients today. Government will be forced to do it, whether it's political advantage or just for the sake of the people.
Okay, thank you, Jack. We go Brian, Ben, Amelia, Jack, Rod.
Okay.
So
Great.
go ahead, Brian.
You're on mute.
There we go. I agree with Jack that one of the big ones and one of the most immediate ones will be the proposed changes in governance that the government is putting forward. God knows where that might end up, and I hope it's all for the better. The other part, though, I think the whole impact of the growing number of senior citizens and those that do not have resources for proper dental care will present a much larger challenge than it does even at the present time. And so that's something that's going to have to involve a lot of, I think, change in government's approach to funding and the eligibility for those services as we go forward. So the two things I would see is the governance reforms and that growing need for proper dental care and access to care, as we've said, and all the issues that will be have to be dealt with around that. And they certainly will involve the college as well.
Thank you, Brian.
Thank you.
Ben?
Yeah, I echo Jack and Brian's comments that government is a huge external disruptor in terms of governance reform, in terms of the college performance measurement framework, as well as both the Ministry of Health as well as the Office of the Fairness Commissioner. These are all huge disruptors to the college, and so this has to be one of the top two. The other thing I want to bring attention to is that we're still in a pandemic, and although things appear to be improving, we also have to, in the next 2 to 3 years, have to consider what a post-pandemic practice is like. And right now we're using enhanced precautions, and we have to think about loosening our restrictions according to the data. So to me, that's an external disruptor. Thank you.
Thank you, Ben. Amelia?
Okay, I only have one thought, which I agree with Jack and everyone else about the government. I don't believe that the changes they're recommending aren't necessarily going to be any better than what they are, and they could be worse. It's hard to say.
Okay, thank you. Rod?
I too think governance is going to be one of the major ones. I'm not just governance of our college, but the proposed, and I think what's coming is amalgamation of several colleges, and it's not just going to affect ours, but you got to realize that there's 400 regulatory bodies across the province of Ontario and all ministries, right? And there's substantial benefits from amalgamating and or deleting or getting rid of some of those bodies. So being in a conservative government, I know this is on their mind. So that would be, we haven't even addressed that, and I'm not sure why they didn't bring it out this go around, but I think that's where they're heading. Could someone, just before I go into my next one, tell me about what the definition of corporate dentistry is?
The definition is corporations can now buy and own dental practices. So the actual dentist who owns the practice may be an investor dentist or maybe part of the corporation, doesn't work in the practice. So there's an outside entity, either a corporation or an investor dentist who owns the practice.
So it's someone like an accounting firm or a law firm or anyone who sets up under a corporate umbrella, and it's usually done for tax purposes, correct?
Well, I think by our regulations, only a dentist can own a dental practice. But somehow corporations, like there's large corporations who own like 30, 40, 50 practices in the province of Ontario, and the owner does not step foot in the practice.
Yeah. Okay. And that's legally okay for a practice okay from the regulation?
Because what happens, Rod, is you have a figurehead, a dentist who supposedly owns it, but it's just a figurehead. It's just a name. He doesn't really operate it.
So is he trying to evade professional requirements or regulatory requirements?
No, because each member has to be professional and still has to abide by all the regulations of the college and so on.
Okay, so I'm not as close to that one. I worry about the arm's length. I agree with you that there should be personal hands-on approach to that. What I'm going to raise just separately, I'll let, that hasn't been brought up, but remember, when a previous council meeting we had that PhD present to us on some trends in dentistry going on.
Yeah.
What was his name again?
Carlos Quinones.
Oh, Carlos, that's it.
The new dean of dentistry at Western.
Yeah, West, good. Thanks for triggering that. There was some in that presentation, and some of this may be COVID driven, but there was some disturbing trends of either professionalism or business practices, or that I thought we should have jumped on and kept an eye on, because I thought if left running amok in an increasingly competitive environment where cost and revenue are most important, that those elements might have breeded behavior that, in the worst case, might have driven our discipline procedures, a little askew if the volume that came out of that. So I thought we should have spent more time on, maybe being proactive and getting out in front of that to see if there isn't an issue and trying to manage that issue. Because if it is an issue, it could be, very disruptive strategically and operationally.
So is the issue that you're trying to talk about is, I think he presented that some practitioners were more aggressive in their treatment compared to others. And he listed steps of how the demographics of those who are a little bit more aggressive. Is that?
But aggressive is, like, I sit on the discipline committee, and so aggressive to me meant using practices that weren't necessarily in line. In other words, overbilling, maybe fraudulent insurance practices, or whatever was needed to drive more revenue because of increasing business pressure.
Yeah.
And I don't want to interrupt, but just a heads up, in about a minute, the others will be joining us.
So it's sort of maybe it's something that's coming down the horizon, but it just twigged me that there's something we should keep an eye on, basically, because it could be a major disruptor if it was a major challenge.
Interesting you bring that up, because Andrea in her presentation said dentists were asking for more help or support in running their practices. To me, that reads business help. Like there may be a.
Well, it means they're suffering. I mean, I've got dental friends too, and they're just doing everything they can to drive walk-ins, right, and to justify the overhead that they have to spend. So and there's more and more dentists coming into the area trying to set up. So I mean, it's going to cause some, unhealthy practices. Is maybe a good way of putting it.
So I'll just bring up. Oh, I guess we're done.
Thank you, Andrew. I see you nodding your head. So this was something that concerned you as well. Go ahead. Sorry.
Well, I was just going to mention that, some of those issues will more than likely come up in the broader professionalism project that council sort of endorsed us to do, connected to access to care. It's not exclusively about access, but yeah. And Nalin, if you have thoughts and you didn't get to, you're welcome to email Kathleen or me, and we'll capture yours.
Sure.
Sometimes that's the problem with being the chair. You don't get a chance to offer your own thoughts.
Andrew, this may be another, as you go back out for more survey data to the members, and maybe a way of capturing more of the concerns in this regard too.
Yeah, could be, for sure. We'll keep it in mind.
Thank you.
And Angelo, I'm just going to wait until you give me the heads up to start.
Yeah, folks should be joining us in a few seconds.
Thanks.
So were we supposed to come up with top two? It seems like we came up with 3 or 4, but
Everyone's entitled to 1 or 2 top twos.
That's right.
On aggregate, we may have 4.
We're just good, Alan. That's all. We're just good.
The chair's drunk with power.
Okay, thank you, everyone. So everyone is back in this meeting. I was an observer in the main meeting, and Andrea raised a really valuable point. If your group had a really fulsome discussion and you as the spokesperson didn't have an opportunity to express an opinion, please write that down, send it off to Andrea. So, I mean, there were note takers. That information will go forward. You will have an opportunity to say 1 or 2 things in the 1.5 minute I'm going to give you now. But if you feel something is missing or you forgot something, please send it off to Andrea. She will continue to sort of collect that information. So we are again going to repeat exactly the same process that we did the first time. I am going to still give you each only a minute and a half to do the rapid fire response. And Nalan, I'm going to start with you again, please.
Okay, thank you, Hannah. So the question was, what are the top 2 external disruptors that the college should focus on? So some of the things that our group discussed was, one was government, not governance, but government. Because as we know, the government's reaction to the college is fluid sometimes. So it can change, and it's something that's unpredictable, and it can have, far-reaching effects on what we do. So that was one of the issues. The other one was access to care actually came up, because in the end, we do serve a population, and if certain segments of the population aren't being served, this can cause issues in the future, and certainly can be a disruptor to what we do. And I think the last thing centered around professionalism. And as a subtopic to that, corporate dentistry, is it good? Is it bad? Is the dentistry good or bad? Is there financial or external factors that are acting on the dentist? And does that affect the public? So those are the 3 main things: government, access to care, and professionalism. Thank you.
Thank you very much, Nalan. And now, Nancy, I'm going to turn to you to sort of give us a quick overview of highlights from your group discussion, please.
Awesome. So our first external disruptor that we discussed was COVID-19 as being a major disruptor. It could be potentially an indicator for things to come. We need to insulate and repair ourselves so that, and we alter the way we deliver care so that in the future, we are able to not shut down, and we've got basically emergency preparedness. Our second disruptor that we felt was needed to be discussed was the upcoming changes to legislation. We felt that that will be a disruptor to the college, as we feel that the reduction in size of council and committees could potentially affect the way college processes are handled. And thirdly, we had another was corporate dentistry, virtual care, and artificial intelligence as being a disruptor in terms of professionalism. We felt that there's a need to separate the business of dentistry from healthcare. That's it.
Great. Thank you very much, Nancy. And now I'm going to turn over to you, Joseph, please.
Yes, many of the same themes that have been brought up previously. Number one, emergencies, COVID-19, and what could come next if there's another type of pandemic that we should be able to prepare for that as best as we can, acknowledging that it is somewhat unpredictable or very unpredictable. Climate change, that is also fit under the umbrella of emergencies. Reducing plastics, which I understand is a particular concern in the dentistry profession, as well cybersecurity. With the times we're living in, we know that it's ever more important to ensure that our internet, all of our computer systems are very secure, and that is definitely an external disruptor that could wreak havoc on our operations. So that all fits under the emergencies umbrella. Number two, government reforms, which has been talked about. And also, obviously, as Nancy mentioned, she talked about about what would happen with the reduced council size. But even in the process of those reforms, it requires a certain nimbleness of the college to be able to respond at a moment's notice, to provide feedback, and so that obviously is a disruptor in and of itself, just the process. And thirdly, corporate dentistry. There's a concern that causes a decrease in the quality of care.
Thank you, Joseph. And the last group I'm going to turn to is you, Osama, please, for comments from your group.
Sure. So again, some of the comments have already been made before, but we divided them into three categories for the external disruptors. One was the biologic external disruptors like COVID, and we brought up the previous case of SARS. Financial disruptors hasn't been spoken much of from the previous groups, but a case like, let's say, there's a recession. what's going to happen to access to care for patients. And then finally, the common theme today with the ever-changing political landscape and inconsistency from government to government in terms of how that will affect the message of and eventual public safety. We did mention some ideas around something we noted was patient care continuity. So with all of these external disruptors, can we have patient care continuity? And that's the kind of underlying theme that we should always be going back to, and how there should be some sort of playbook that we should use. And it shouldn't be dependent more based off of the actual disruptor, but what playbook do we have in place to make sure that the patient care is continuing. So we'd have that based off of case studies, a baseline set of data to ensure that, again, public safety is met as well as patient care.
Thank you, Osama. And I would just like to thank everyone on council for your very thoughtful and I think relevant feedback. And at this point in time, I am going to turn it back over to you, Andrea, because I know there's still something that you need to do to wrap this section up.
Yes, thank you very much. And thank you, council, for all of that feedback. That's great. We're going to move into the next, sorry, let me just advance this. Setting up the polling question we have for you. And so really just wanting to introduce this idea of the distinction between strategy and operations. So, those of you who've gone through strategic planning before will know it's a critical distinction. We want to really make sure our strategic plan is focused exactly on that, on strategy, higher level visioning, higher level sort of objectives. And then the operations is how we get there. How do we implement that? The reason we wanted to bring this question to you is it's going to really help us. As Dan said, it's really critical that we have a tailored strategic plan, that we are focused. And so getting a bit of input from you about where you see the distinction between these two concepts is really helpful. So that's what I'm going to ask you about. And in fact, I'm going to pitch to you proposed definitions, and I'm going to put them up in a second. But the question, just so you can plant in your mind, the question we're going to ask you for polling is, do you support these proposed definitions? So the first is, for strategic projects, what we're proposing is that those are projects that involve transformation of some sort, movement toward an aspirational goal or objectives. So put differently, they don't describe things we're currently doing, but rather are things that we aspire to. That's proposed definition number one. Number two, operational projects. Proposing that those are ones that involve the implementation of existing practices. So just to kind of tie these two things together, the idea would be you might put something in a strategic plan, we work towards, we achieve that. Once we achieve it, doesn't mean that it necessarily goes away and that we forget about it. It transitions to operations. It becomes part of how we do business. Those are the concepts. So in a second, I'm going to turn it over to Angelo because he's going to take you through actually how to do polling, because we want to get some responses from you. But again, I'll just put up the definitions. And the question for you is, do you support these proposed definitions? So, Angelo, I'm going to stop sharing the screen and allow you to do things. And then I'm going to come back very briefly, Council, after you vote to tell you about next steps.
And Andrea, I see that Judy has her hand up. Do you want to entertain that question now before we move on to Angelo or not?
I guess I would just say, Judy, is this something that is a clarification question or is it a comment?
Okay, so
clarification.
Okay, great.
Judy?
Could you just put the definitions up again?
Sure. Yeah, just give me 1 second. You seeing those, Judy?
Yeah.
Okay.
So what I'm just wondering is, just so that I understand what you really mean is operational projects. Does that mean involve the implementation of existing strategies?
It could be. So like, maybe I'll give you an example of how I think it could work. So in our current strategic plan, you'll remember that we have an objective that speaks about, having decision-making be supported by evidence. So at the end, using these definitions, when it's a strategic project, we're putting into place mechanisms and supports that allow us to achieve that. Once we achieve it, it becomes an operational project, i.e. it is how we make decisions. As a matter of course, we will always be supporting decisions with best available evidence. Does that help, Judy?
It sort of does. I just think that I'm just wondering if operational projects isn't too narrow. But
sure. I mean, really, maybe this will help, but I'm not sure. What we're trying to get at is just the distinction. If project is throwing you off, what we're trying to get at here, or what I'm trying to get at is
it's practices that it's throwing me off.
Oh, okay. Really, what we're after, in a more high level way, is just how do you see the difference between strategy and operations? So, if that helps at all, we're really just trying to ask you about the concepts, because it will help us determine how we can focus the draft that we bring back to you. Are you okay, Judy, for us to turn to the polling?
Yeah.
Is that
okay?
Okay, wonderful. So Angelo, I'm going to ask you to work your magic.
Sure. So I will activate the poll shortly. And for council members, you'll see the question pop up on your screen. It's a yes/no question, and you simply select your answer and go from there. So that'll be live shortly. We're up to 19. I think we're still waiting on, we're up to 23, so we're still waiting on one person to complete the poll. And there we go. So 19 yeses and 20 yeses and 5 noes for the poll.
Okay. Thank you, Angelo. And thank you, Council. I'm going to come back to the deck in a second, but I will just say, if any of you have comments, or those of you who in particular who didn't support the definitions, if you have any follow-up, distinctions you want to bring to our attention, please feel free to send me an email, and we'll take your feedback on board. Just in the interest of time, I'm going to very quickly go back to the deck just to talk to you about next steps. So there's a number of things we're going to be doing following this meeting. We're going to be going through all of the feedback you've given us today, together with everything we've received really through our tactics to date. All of that is going to help us prepare a draft strategic plan. We want to be able to put something concrete down on paper so that you can react to something. That will come to you in June at your meeting. And our goal there is to really get your feedback on how that draft is shaping up. Does it line up with your ideas and thoughts? Ideally, if you're content with it, we'd like to go out for external consultation on that draft. We want to go back out to all of the individuals that provided us feedback to date, and hopefully some new participants too, and really get a read on how external parties feel about it. We would then, based on that feedback, propose some revisions, I'm anticipating, because usually we get great ideas and thoughts. And then it would come back to you at your September meeting with a sense of what we heard from that consultation, proposed revisions, and we'd be asking you for final approval in September. And just very briefly, the reason why the timeline is what it is that we're trying, the idea being is this strategic plan would be implemented Jan 1, 2023. We want to make sure that we can align as best we can to our budget planning cycle. So that's why we are really looking to have your final sign off in September. It's just so we can line up all of those different intersecting processes. And that's it for me. I just really, before I turn it back to Hanno, I just really wanted to thank all of you for your engagement and your feedback. As we've said a couple times, if there's anything that you didn't have a chance to capture today, we do have the notes that we'll be relying on. If there's anything additional you think of, please do send me an email. I'd be happy to take further feedback, and we'll take that into account. Thank you, Hannah. I'll just turn it back to you.
Thank you so much, Andrea. And moving to our almost final item on the agenda, it is the issue of other business. And Dan does have a brief to share with us. Or you're going to brief us on a letter that you received. But Dan, I also promised there were 2 speakers from your report. So do you have a preference in which order you would like to do this? Do you want to entertain the 2 questioners from your report first, or would you like to do the letter from the Ontario Fairness Commissioner first?
So why don't we do the letter first? And I have one other item just as part of my remarks that I forgot this morning, and I just want to make, and then we can open up wide for questions.
Okay, thank you, Dan.
Okay. The report that I forgot to make this morning, and I should have, is I wanted to just mention to council that a regulation was passed a couple of weeks ago that allows oral and maxillofacial surgeons to refer or requisition directly for MRI testing of patients. This has been in the works for a long time, obviously prior to my arrival at the college, and standards were developed based on a letter that came to the college 3 years ago, I think, from the minister that asked us to develop standards that would support this regulation that effectively enables oral and maxillofacial surgeons to make this direct requisition for MRI. What it does is it promotes timely access for patients. The way in which it worked prior was that patients would have to work with both their oral surgeon and their family doctor and have multiple appointments and get on waiting lists and then get images provided back to all of the practitioners who were involved. And this makes it much more direct and streamlined. So very pleased that it culminated a couple of weeks ago in an approved regulation that was posted by the government, and we also sent around an e-blast to the profession. So apologies for missing that this morning, but that is a great success for patients in the province. So I wanted to spend a little bit of time talking about the letter that I received from the Fairness Commissioner, Mr. Erwin Glassberg. And before I talk about the letter, let me just give you a bit of context, because I know we haven't had a lot of time to talk about the Fairness Commissioner. We have some new council members. Essentially, the Office of the Fairness Commission was established in about 2006, and it was established in response to individuals who were internationally trained, who were not able to access in various professions the kinds of assessments, examinations, and licensure that would allow them to be authorized to practice in Ontario. And the office itself has been created to ensure that registration practices of not only the 26 health colleges, but a number of the other colleges that oversee accountants, lawyers, professional engineers, established to ensure that our registration practices are objective, impartial, fair, and transparent. So that's the context. The commission itself has been around for probably 15 or 16 years and has had a lot of interactions with regulatory bodies over that period of time. One of the responsibilities of the Fairness Commissioner is to ensure that if colleges use third parties to assess qualifications, third parties might be national examination boards, which is really what this letter is about, if we use those third parties, we have to make reasonable efforts to ensure that those third parties also provide practices and assessments that are impartial, objective, transparent, and fair. Now, you can see the dilemma in that the Fairness Commissioner in Ontario does not have direct authority over national bodies or other bodies other than regulators. We as a college have some influence over these bodies, but we do not have direct oversight and control. And this has been one of the areas that I would suggest has been a very big challenge for the Fairness Commissioners in the province over the last 15 or 16 years, trying to really understand how best to move the system forward. Over the last couple of years, and really the instigating step for the Fairness Commissioner to look at us and to look at the National Dental Examining Board was a nullification of an examination administered by the NDEB back in December 2020. And the reason was that the results were so outside of the practice or the previous results of exams that one plausible explanation is that there had been some systemic cheating, that there was a breach of examination questions, and they had to nullify the exam because it wasn't fair to the process or to candidates, that there may have been any number of individuals that may have had their hands on a number of questions that helped for that success on the exam. And that was really a point in time where the Fairness Commissioner began a number of discussions with this college and myself and Andrea and others, and with the executive director of the NDEB, Marie Dagenet. We have provided, and I think it's pretty clear in the letter that we sent to you, we have provided copious amounts of information and materials. We, as a college, have been working very hard to cooperate and collaborate with both the NDEB and the Fairness Commissioner. We have provided all sorts of information that would allow them to understand how the dental assessment and examination system works, and our role and the NDEB role. The NDEB has been extraordinarily collaborative in talking about how they are improving. And ultimately, the Fairness Commissioner still wants us to do more. And so that leads to the letter. And the letter has been framed in the form of advice to the college. This is a part of the statute for the Fairness Commissioner. They can provide us with advice. And if you had a chance to look at the letter, the first area of advice is around strengthening our accountability with the NDEB, and in the form of some kind of agreement or contract, the terms of which we haven't even begun to think about or talk about, but it's trying to incorporate a level of oversight that has not existed with RCDSO and the NDEB. But as I understand it, since starting these conversations, there is some form of agreement between the NDEB and the Dental College in Quebec, the ODQ. And there are a number of other examples of professions who are regulated in Ontario and also have national examination bodies where they've developed contracts or memorandum of understanding. So that is one of the areas within this letter that is directed to us. The other two relate to the NDEB itself and looking at things like service standards and also what they've called resilience. So ensuring that the NDEB has appropriate risk management in place for things that relate to examination questions, whether it's security or having enough questions, whether it relates to other aspects of risks that come along with running an organization that delivers examinations that are high stakes. What I am going to suggest to you are a couple of things, and then I'll give you a sense of where we see us as staff and as council moving forward, or as a college moving forward. There are a number of complexities with what we are being asked to do, not the least of which is trying to develop an agreement with the NDEB that does not jeopardize or put at risk national standards and labor mobility, which has been a priority of the federal, provincial, and territorial governments for the last dozen years. And what we might want and what we might expect from the NDEB doesn't necessarily equate to what the other 9 provinces and their dental regulatory authorities might want. So we come up with, potentially a clash between this concept of an agreement and labor mobility and national standards. And I mention that because it's a complexity. I'm not suggesting we can't do something, just that is something that I'm keeping first and foremost in my mind as we walk through some of the next steps that I'll comment on. And it is one of those areas that I think we have to be extremely mindful of. And I will work with my counterparts in the other provinces to figure out some different ways that we could address it. The other complexity is that we might go forward with great intentions and we might make some progress on an agreement, but at the end of the day, the NDEB is an independent organization. It may choose, for whatever reason, not to enter into an agreement with us. And we don't have necessarily an alternative. We could say, well, then we will run our own examination in the province. That would not be my recommendation for all sorts of reasons, not the least of which is the extraordinary expense that goes into developing and administering high stakes examinations. But that is something that we have to be very mindful of as well, that the NDEB has some relationship with us. We have one representative on their board of a dozen or more people. That doesn't mean that we control the board. It doesn't mean that we control what they do. So there's always that possibility that we won't be able to reach an agreement. But what we can do, and what I've started already, is I've obviously had a conversation with our legal counsel, Alan Bromstein, to really understand the history, to understand from Alan's perspective, some other work that's happening across Ontario with other colleges. I've had a preliminary discussion with the executive director of the NDEB. We have both agreed that we will entertain some discussions and sit down and see if we can identify some particular areas that we believe we could move forward with and start to develop an MOU. I will be sharing this letter. I haven't yet. I wanted to make sure that I talk to council first. I'll be sharing this letter with my counterparts in the other 9 provinces, who also, some of which have fairness commissioners. And also we all have a stake in national standards and the consistency of those standards and labor mobility. So I'll be sharing that with them and hopefully having a discussion at the April board meeting. I will be responding back to Mr. Glassberg and providing some preliminary thoughts and a response and an acknowledgement of the letter and what they've requested, but also pointing out some of our areas of concern and moving forward. And I think the relationship that we have now with the Fairness Commissioner's office is good. And I'll want to make sure that the commissioner is aware of and also providing any advice that he might have in terms of how we move forward, how we're proposing to move forward. So I will stop there, and certainly you'll have questions and also entertain, as you said, Hanno, any other questions that you have about any of my remarks from this morning.
Thanks, Dan. And maybe what I will do is start with the 2 people who did have questions about your report this morning. And then if other people want to have questions that they can ask, I will maintain my speakers list. So Vivian, you were the person who was first on my list that I cut off. So I'm going to address it to you first. And it's possible that your question or concern has already been addressed. But if not, please go ahead and ask your question of Dan.
Thank you, Hanno. Basically, it's regarding the survey results. Great job, Dan, and your team. And I was wondering, moving forward, this is a survey regarding the RCDSO. Are there any plans to maybe survey the non-dentists who are like visiting the website, contacting RCDSO?
Yeah, thanks, Vivian. We're talking about it. I think we're not quite at the stage of a plan, but we do have, and this, as I mentioned this morning, Michelle Tremblay has been providing leadership to this entire initiative. We've been looking at various points where we can gather information from various audiences, both the profession and the public. So as you said, it could be the website. We've all been part of websites where you leave and they ask you to do a a 2-question survey. It could be the members portal. It could be through the complaints process. I know we have plans that are looking at how we understand the experience for both the individual who has complained and the individual who has had a complaint made against them. And there are different ways to do that. So we are building on our ability and capacity to actually gather more information, and the public is a key stakeholder in that. So more to come, and you will hear more about that.
Thank you.
Next on my list is Brian Smith.
Thank you, Hannah. My question has been answered. Thank you.
Thank you. And when I was looking through, I didn't see Mark Eckler. I saw your raised hand, and now I don't see it. So you don't have a question. And Ram, are you wait? Okay, I think you do have a question.
Dan, is there a timeline given by the Fairness Commission?
Well, the only timeline that was provided in the letter was in 4 months to check on our progress. Now, 4 months goes by in a blink, and I will have that conversation with Mr. Glassberg. In terms of progress, I've mentioned some of the progress to date from February 17th, which is talking to some of the various parties involved, including the NDEB and other DRAs. This is another challenge that we'll have to work through in terms of how much of a priority this will be to other parties. And we'll have to work through that. I think the biggest thing that I can promise you is that I will keep the Fairness Commissioner informed of progress and what we're doing. I don't have a particular timeline because I don't have enough information to make a timeline at this point.
Okay, thank you.
Thank you. And Dan, at this point in time, there are no other questions. So we are almost at the end of our agenda and sort of heading down toward our in-camera session. So what I would just like to do is take a moment to remind Council of the fact that our next Council meeting will be held virtually on June 16th, 2022. And as we approach the end of our formal public agenda, I just want to let you know that in a moment we will be taking a short 10-minute break. When we return, Council will be moving directly to an in-camera session. After the in-camera session, we will resume the full meeting, but for the sole purpose of adjournment. For our in-camera session, we will just have Council members, legal counsel, Alan Bromstein, along with the registrar. We will terminate our live stream, and I will ask that all staff please sign out of the meeting when we make that move. And before we go to the motion to move in camera, I would just like to say that this is my third meeting with the Council. I want to express my sincere appreciation to the staff for the incredible amount of work that they have done behind the scenes to get this Council meeting running the way it has, for the support that they have provided to me. I'm in awe of your tech staff. What they can do and how they can support us behind the scenes is truly inspiring and makes an old person like me very, very grateful that someone who knows what they're doing, I can just sort of fire off a message to them and they're looking after it all. I would also like to take a moment to thank Council. I am impressed by the amount of preparation you do when you come, the questions that you raise, the discussion that you have. It is really, I think, very gratifying for any person like myself who is zooming in from the outside and not a part of this team. And I would like to end by also thanking any of the public and any of the other observers who have tuned in for today. So having said all that, I would like to call up motion number 5 on the screen, please. And motion number 5 is that Council exclude the public from the meeting to receive legal advice and or opinions from the college's solicitors in accordance with clause 7(2)(e) of the Health Professions Procedural Code, which is Schedule 2 of the Regulated Health Professions Act 1991. So if I could have a mover for that, moved by Mark Trudell, seconded by Benjamin Lynn. All in favor? Opposed? Abstained? Okay, that motion is carried. So thank you, Council. It is now 10:29, so I'm going to suggest we do a 10-minute break and that we reconvene here for the in-camera session at 2:40. And my understanding again, and I'm going to throw it probably to I don't know, to you, Dan, maybe, or to Tech. So those of us who are remaining for the in-camera, in 10 minutes, simply just, unmute and open up our video again, and we will be in the in-camera session. Is that correct?
That's correct.
Perfect. Thank you so much. So we will see you here. For those of you participating in camera session, we will see you here at 2:40. Thank you very much.